Here you go.
I think you can handle them. Hey, we got new assignments, we got new chairs, it's a new assignment. It says Bob on it.
Honey, you just wanna make sure you don't sit next to Jim, huh?
That guy that sits over there. I'm gonna be here someday. No.
She didn't even have to think about that, did she?
Where's it going? I'll grab the pot.
I didn't. Yeah. We'll probably take a break. Okay. It should be fine, not in the fridge for a little bit, I think. We're up with application. Okay. Oh, no. The only one I didn't get was,
Here's these three that you can always decide on,
but that's fine.
these are the ones that we need.
No, I can't complain. Nobody listens, they sure would, they sure fail. Too bad.
Yeah, well, ours might be
Too bad.
locked, but. Okay. Okay.
Why did you do that, Dave? You don't figure we can cook. We won't be coming out of the freeze up, so. There's 3 or 4 sewer treatments yet.
Well, you guys been doing a ton of work with. Driveways?
Yeah, that, kind of spent most of the summer working for, Cape out at the high school. Oh. Yeah, it was times, we had 6 trucks. It is 4:30. Extension meeting to order for personnel for September order. Has everybody had a chance to read the minutes of the August meeting? There was 3 of them, 1st, 3rd, and 16th.
I'll make a motion to approve.
Motion is made to approve the minutes of all 3 done. Is there a second?
Yeah, second for what I read.
Second by Mr. Ratzak. Is there any further questions or corrections? None being heard. All in favor signify by aye. Aye. Opposed? Motion carries. Public comment. Is there anybody would like to speak in public comment? Nothing for public comment? Okay. We have a presentation. Alicia, can you hear us? You can.
Yep, I can hear you.
This is from JA Counter. It's 2024 benefit offerings. I guess that being said, I will turn it over to you and you can go ahead.
Sounds great. I'm gonna share my screen and we're gonna talk a little bit today about the benefit, 2024 benefit renewal what we've done, what we've worked on. Just as a reminder, my name is Alicia Schwartz. I work at J. Counter Alera Group. We are a employee benefit consulting firm. I've been working with the county for a little over a year now. Really excited to be meeting with the personnel committee today. I know we've met a couple of times so far. So again, we're going to talk a little bit about what we've done for 2023, on initiative strategies. We've been focusing on how the medical renewal has come about, and then the changes that we're recommending to make for 2024. So if you have any questions, please feel free to stop me. This does not need to be a lecture by any means, but just some information that's hopefully helpful. So one of the things that we focused on for the year, this is our second year doing an employee benefit survey. We call this a value perception survey, and that's a very intentional name. The reason why we call it that is we really want to make sure that we work towards improving the perceived value of benefits by your employees, right? The county makes some very, very large investments into the benefit program. We want to make sure that that money is going to good use and that it is effective as a recruitment and retention tool. So in doing that survey, here are some of the things that we saw. A lot of the information that we saw this year was a repeat from last year. And so, but it's consistent, which is helpful for us to understand where we really need to allocate some of the funds and invest in the plan to improve it. So a few overarching themes that we saw that employees found that an increase to the benefit was almost more important than an increase in wages. We noticed that people were really interested in having more options in their benefit plan, which means that they were willing to pay more premium for a better health plan and medical plan design, and that they were also interested in having additional options in the benefit plan to really help tailor, so to speak, the benefit plan that would work best for them. So those additional benefits that they were interested in included work site, which we call work site. We'll get into kind of what that means. Essentially, it's cash benefits that are paid to an employee due to injury or sicknesses. Employer paid life has come up time and time again. Employees are really, really looking for some type of employer paid county funded life insurance plan. And then better maternity leave coverage. So it's helping members who are on maternity leave or paid parental leave have other benefits that they can either purchase and or get from the county. And then we did ask some specific questions around the FSA. You have a flex spending account, different than a health savings account or HSA. There haven't been a lot of participation in the program, and so we just asked employees, and there are hardly anyone using these benefits, but the county is paying administrative fees to manage them. So we did ask about that, and not a lot of traction on that plan. So those are some of the using this information kind of helped us make some decisions on what to do for 2023 in order to improve the benefit plan for 2024. And one of those things was marketing your ancillary benefits. So to us, ancillary is just all the benefits that are not medical. So dental, vision, short-term disability, long-term disability, anything else that comes with that. So we did market your ancillary plans, and we were specifically looking for a handful of things. One of them, of course, is potential for savings, right? Can we get rates that would provide savings to employees for employee paid benefits? Also looking to improve the customer service currently offered. Right now you're with principal, and there has been some issues in claim management that we wanted to try to kind of help employees with. We also have had as a consultant with other clients, have had really good luck in asking ancillary carriers to help subsidize the cost for what we call benefit technology. Benefit technology is really taking open enrollment and benefit changes and things online. So currently the county is doing paper apps, right? So Jamie or Ashley or whoever is in that role during open enrollment is chasing down each and every employee, asking them to fill out applications for different plans and different carriers, and then having to data entry those into the health plan portal and those things. So it's kind of an arduous job, takes a lot of time. So we were hoping to find maybe some administrative services that would provide relief to the HR or admin team when it comes to open enrollment. So with that, we'll jump into what we see coming up for 2024. So let's talk about the medical renewal first, because I think that's always like the biggest line item in the budget when it comes to benefits, and I know everyone's dying to know what it is. So this slide has a lot of stuff in it, so I just want to try to break it down. This is your renewal document. So currently, Security Health Plan is offering 2 different benefit health plans to employees. And the only difference between those 2 benefits is your network. So on the left side, you have a Premier network, and on the right side, you have a Simply One network. Simply One is a narrow network, and a narrow network just means that your employee is saying, I would rather pay less in a premium and only seek care through the Marshfield Clinic system. And they get a little bit of a premium break, roughly about 20%. So this is the renewal. So if we take that very bottom, this very, very bottom of the slide, you can see Security Health Plan offered the county a 4% rate increase. Now, Security Health Plan's book of business average is around 6.5% increase. Our industry standard is around 11 to 12%. So 4% is really good news. No one likes to see their rates go up, but I think we all are well aware of what's going on in the world and that everything does increase over time. So I'm really, really excited about the 4%. This is a great renewal offer based on your claims and what's going on in the population. So I'm gonna pause there because that was a lot of information. Any questions about the renewal? Perfect. Okay, so let's talk a little bit about what we're hoping to do and what we're recommending in 2024. So this next slide is a different plan structure offering to employees. So understanding that employees are looking to have the opportunity to purchase a better plan design for more premium, we put together a different kind of structure this year. So you have a base plan and a buy-up plan. Both of these plans will be in the Premier network. Last year we offered that Simply One network. There was about 11% of the population that really enrolled in that, so it didn't have a lot of traction. And so we thought maybe this would be a better solution, not offering 2 networks. So I wanted to draw your attention to this spot kind of at the top third. When you talk about plan design of a medical plan, what employees really want to know is what's my worst case scenario? What's the biggest out of pocket that I have, right? So when we do that, we have to start with a deductible, which if we look at just on the base plan on the left side, we look at the deductible. So if I'm enrolled as a single, I'm paying $5,000 in deductible. If I'm a family, I'm paying $10,000 in a deductible. After that deductible has been met, employees now have specific copays for prescriptions and doctor visits, but they have a max out of pocket, that's this here, OOPM, out of pocket max. So worst case scenario, I'm gonna be paying $6,650 or $13,300. Now we have to attribute or take into consideration that the county is offering an HSA contribution to the plan to help take down that spend a little bit. So this in the center is reflective of the HSA contribution, and then we provide an adjusted deductible and max out of pocket here, okay? So in the new plan, we are taking the employer contribution, the county's been, the county's been contributing 85% of the total premium, so we would keep that amount. And then the HSA contribution would stay the same. We're taking the same contributions from the county and moving them into a lower health plan, which decreases the employee's out-of-pocket deductible and out-of-pocket max. So the total expense is adjusted now from 4% increase to 6% increase. So that is the total out-of-pocket adjustment for the county would be about $115,000. Now that is an estimate, and it's an estimate because we can't predict exactly how many people will enroll in either one of those plans until we offer them those solutions and they get to pick. But at the end of the day, if we keep the county contributions at 85% of the base plan, and employees have the option to increase their contributions, which is reflected here in this employee monthly category, they can purchase that more generous plan with a lower deductible and lower out-of-pocket maximum. I'm going to pause again there for any questions. And Ashley, Jamie, if I forgot anything, please holler.
No, I think you hit it.
All right, we'll keep going. Good? So let's dive into the ancillary marketing results. So really quick, I'm gonna go really high level and then we'll dig into some of the plans that are new to the county just to kind of give you an idea of how they work. So we did market to about 5 carriers in this RFP process. We eliminated 3 of the 5 just based on their lack of cost savings and no technology options or not a good fit in terms of that technology credit that we were able to get through a couple of other options. So we did narrow it down to 2 carriers, Symetra and Mutual of Omaha. And then we also asked both carriers to include new benefits to kind of meet the needs of the employees as they have requested. So employer paid life, those worksite or voluntary plans, and then family medical leave administration services. So we'll dig into some of that. We did, when we evaluated the vision and dental plans, those are currently with Delta Dental. We didn't find any cost savings or any reason to move those, and so we would recommend no change for the dental and vision plans. So from a marketing summary perspective, one of the things we had talked about was offering an employer paid or county paid life plan. And Symetra was offering for just shy of $3,000 a year, $25,000 death benefit to all employees. So that was a great offer. Mutual of Omaha was significantly higher at $8,000, so Symetra was clearly the best choice. Family leave administration, and I'm going to talk about that a little bit more in the next few slides about what it is and why it's important. But that is based on a per employee per month fee and would roughly cost the county about $3,600. The rest of this is just kind of explaining where we are at from which plan was most competitive and why we were finally making a recommendation to move to Symetra as the finalist for all the benefits that we've talked about: short-term disability, long-term disability, and the new plans and FML administration. We do not have the principal renewal yet. Those are not going to be released until October 1st. But last year, as a comparison, the plan on the long-term disability went up 24%, and on the short-term disability went up 9.5%. And so we were able to find some cost savings on the long-term disability. That is an optional voluntary plan for employees to purchase, and it did go up a tiny bit on the short-term disability. Okay, let's talk a little bit about the new benefits that we are looking to provide the option. These are all voluntary, and again, kind of helps solve the request from employees to provide benefits that allow them to pick coverage that is really a concern to them, right? So the three new benefits are accident coverage, critical illness, and hospital indemnity. Each one of these benefits is the same in that it offers a cash benefit to an employee directly, regardless of health insurance or medical insurance plan coverage, to help them pay for unexpected events. So as an example, accident coverage is going to pay a cash benefit due to injury. So if they have a concussion, they get $200. If they have to go to urgent care, they get $200. They break their arm, depending on how severe the break is or what kind of treatment, meaning they just have to do a cast or they have to do surgery, you can get up to $5,000 in benefits. I have a son who is 17 and is terribly accident prone. And this plan is really, really, really good fit for people with families with active kids, because it is inevitable that one of them is going to get hurt or have stitches. And those unexpected costs can be a little overwhelming to pay when you're not expecting those things to happen. On top of that, all of these benefits, you have your medical plan out-of-pocket expenses, but you also have other expenses that are kind of things that you don't really think of that are going to cost you, like time from work, travel time, if you have to go to the hospital, you're taking time off of work, you may have to have an overnight stay, those types of situations. So the critical illness is specifically cash benefit where the employee picks the benefit amount level and they get a payout based on a significant diagnosis. So examples of those would be cancer, heart attack, strokes, those types of things. The hospital indemnity plan is a cash benefit for hospital confinement. So we talked earlier about maternity leave coverage being something that some people are asking for. This plan would really help with those individuals. It offers $1,000 admission for hospital stays and $100 per day, and then pays in addition to that if it's an ICU stay specifically. One thing to note is all three of these benefits provide a $50 wellness credit for anyone who's covered on each plan. If they get any of their preventive care screenings, they can submit those screenings to Symetra and get a $50 wellness credit. So when you think about the cost of these benefits, those are really nice, kind of helps pay for the benefit itself, especially if you have several kids and yourself on the plan. So I'm gonna pause there. Any questions about that plan? I think Jamie, the host, is muted, so if there's any questions, I'm not hearing.
Oh, sorry. Nobody's asking. Sorry, we had some interference going on in here, so.
Nope.
Just trying to
Totally
fix
good.
that.
Thank you. Okay, I'm gonna keep trucking along here, right? Only a couple slides left. So let's talk about Family Leave Administration, or FMLA, as I referenced it prior. So the state of Wisconsin and federal law requires employers to have and put into place protection for employees when they have to leave or take time off of work due to sickness, illness, injury, and caring for family members. And the rules around federal family medical leave are very specific, and without proper training where an HR professional may have specific credentials around it, we often find that this is an area of risk for employers. Not to mention that it does require a lot of time and effort to manage FML. So as an example, an FML can be as easy as maternity leave, right? You're protected for 12 weeks, you get your job back when you come back, you can't be fired during that time off of work. But there's also a lot of other intricacies around medical leave that a lot of employers don't know or aren't prepared to manage. Another example would be migraines. So if you have an employee that suffers from chronic migraines and has to take time off of work, that's called intermittent family leave and should be protected under this law. And this is an area where we find a lot of issues and lawsuits around unlawful terminations. And so in the context of having this HR position unfilled for this amount of time and understanding where we can help and outsource some things, this is an area where we thought this would be a good fit. So Symetra would be able to consult with the county, reviewing their current practices, making sure that people are living into the laws appropriately, working with managers to understand when to recognize a family medical leave. They will manage the intake of claims, which is really, really important. So that just means that they will set up an employee with Symetra to say this person has a leave. They need to be signed up. They'll work with decisions, coordinate documents, take position statements if that's necessary. And then they also do what we call claim coordination, which is really important. So once somebody has maybe a short-term disability claim or an FML event, Symetra is already looking at all of the other plans that this individual is enrolled in and making sure that those claims are all covered and kind of managed together so that an employee isn't calling one short-term disability claimant here and one accident injury claimant there. So that is family medical leave. I think I mentioned before that the cost for that is around $3,600 a year for the county to outsource this plan. Any questions on that? Okay, last slide I have for today. So one of the other things that we had talked about, again, in the context of outsourcing and trying to help lift some of the administrative burden that the county has to do to manage the health and welfare plan, benefit technology is one of them. So we are partnering Symetra and Clarity together are partnering to provide the county with benefit enrollment technology. And Symetra is actually subsidizing 100% of the cost for this technology. So it is cost neutral to the county, which is really, really great news. So Clarity is a company that is an enrollment firm, and they will provide support around annual enrollment, benefit counseling, helping employees understand what their benefits are, how to enroll, what to enroll in, which plan is the best as we walk into this new dual plan base and buyout, understanding which plan is right for them, if they take medications or if they don't doctor much, which plan makes the most sense. And then also the technology. So from this point forward, if an employee has a question about their benefits or does open enrollment, they can sign into a portal and do all of their enrollments online, and then always go back to find out what they have in the past, or if they need to add a baby, or if they get married, they can make those changes online. And it creates really safe efficiencies for the county to be able to manage any changes as deletes those types of things. Again, we talked about that being cost neutral, and that Employee Navigator is the platform that we would be using, and that HR will have access to run reports and do all kinds of other things in the context of benefit management.
Hello?
So that is all I have. If there's any questions, happy to take those.
I got a question on this urgent care thing. If you go with Security Health, don't have a urgent care thing here now, was that a emergency room? Do you think?
You're talking Marshfield Clinic here in town. They do offer urgent care during select hours.
It's gone, it's gone now. basically.
Okay, but yeah, under the Premier Network, it's not just the Marshfield system. That's open to Korea and.
Yeah, the Premier Network really.
We can go to emergency room for $200.
No, that's the copay.
Your insurance covers it, and then that is kicked back to you to add to it or whatever, or your copay.
You're only gonna get it for $200. But urgent care out here, they don't have anymore. Right at this time.
Any other questions from anybody here for Alicia? She's with us here. Jonathan? Jim? I'm gonna read through this one. I'm in the same boat. I'd like to digest a little bit more when I get home, so. Appreciate.
Sounds great. If there's anything else,
Let us
Jamie and
take,
Ashley know how to reach me.
let us take a look and direct through Ashley if we got questions after I sit down and digest it. I think Jim's probably in the same shoes. Everybody look at his face.
He's got a lot of questions.
Thank you very much for your time.
All right, take care, everybody.
Thanks, Alicia.
Thank you.
Good job.
All right, I guess the most important thing, I guess, that, is costly that should be aware is, we, found out on Monday that we lost an appeal to the state regarding a mental commitment. There's an individual who used to be in Sawyer County, went to a home shelter in Eau Claire, temporarily resided in Rusk County, and, they chaptered him out of the Eau Claire County homeless shelter, and he's been at Winnebago for approximately 2 months. The state, ombudsman on Monday stated that this gentleman is a Rusk County resident. So, time will tell on that, what happens. He's still at, Winnebago. This was going down there this week, but, time will tell on that there. Other than that, there were 2 other commitments, nothing that's long-term cost to the county. There were 2 adult guardianships, this month. There's 1 child guardianship. The original guardian died, and we're changing the guardianship this Friday. Some other updates on things that are going on. We're still trying to get information from expert billing regarding the information. I sent them a letter last month that if we don't get answers, I think by the end of this week, we're gonna have to do litigation of some sort to have them comply with their contract to give us the necessary info so that we can proceed with other people. Other things, health and human services wise, just some VRBO and B&Bs are increasing, licensure and running into some potential problems there. Good news is last month, we did get the deed and everything signed for that property down in the town of, we had a big vendor, Rusk, down there, where the individuals donated that county, donated the land to the county. That's when, Nick was here last month, or 2 months ago. That's all done.
That's their land, isn't it?
No, not in Atlanta, it's down, other Waivers.
Correct, I don't know if it's been Rusk,
Washington.
maybe Washington, but in any event, that's,
Up there they had some too, but they were gonna keep it for 5 acres.
Yeah, that was by Trails End.
and then other things to keep busy. Hospital will be on the agenda this month again. We got a notice from Marshfield that they're selling that current building, and they're exercising, or they're giving us notice that we want to exercise our option pursuant to an active agreement that we entered into 7 years ago. And then bid opening for the hospital, demolition is on Friday. So,
If that property is sold, does that contract carry the parking lot with it?
so the lease would go with there, the balance of the lease.
Actually, how much time is on that lease yet?
Don't quote me.
60.
It was a 99-year lease and it.
Correct, I wanna say 1986-ish, so I wanna say 60 years plus or minus. So a fair amount of time, but again, if you're buying it, that's gonna create problems, but I guess that's what we'll talk about.
We do have right of first refusal.
So yeah, you have the option first, we can go through the hoops on getting appraisals and things like that, paying 90% of that, or if you don't, then you still have the right of first refusal down the road, so, more to come on that at the county level, or at the county board.
But there's another buyer's now.
No, there's no other buyer yet, before they can even list it, they're pursuing with giving us notice of that, so. Correct.
Any other questions for Rich?
Okay. Right, take care.
I'll get it right on for you. Tell me.
Okay, sounds good. Take care.
This goes before HHS.
You got any problem with the sheriff's office?
No.
Go ahead.
HHS isn't even here, are they?
Is that?
HHS isn't even here, are they?
Jeremy's on call, he's standing by.
Oh, yeah.
Did you, alright, so when I left last time, I think you guys requested that I put something on paper, accurate? Like a proposed side letter? That's what you guys wanted, right?
I think somebody did say that.
Okay, this is just a draft of what it would possibly look like. Does anybody want me to refresh them on any of the information that we discussed last time?
Actually, Phil, can I back you up?
Yeah.
First on the agenda is a reassignment of a temporary jailer dispatcher.
Go for it. Yep.
It's under you, so.
So that is because in the beginning of summer, we temporarily hired a young man to help out in the jail while he was on summer break from school. When I filled out his personnel change form, I had marked him as temporary, but he would like to continue working when he's home for like Christmas break or spring break. So I just would like that to be changed from temporary to reserve.
Anybody got any questions or?
Or you mean part-time?
Yeah, very part-time.
Okay.
That's a good option for him, good option for us, right, cause that's probably the time job that covers the most.
Yes.
And summer.
I'll make a motion to approve.
Motion's made and seconded to approve reassignment of a temporary jailer dispatcher to a part-time reserve jailer dispatcher. Any further questions or comments on the motion on the floor? None being heard, all in favor signify by aye. Opposed, motion carries. Okay, Phil, now back to.
Okay. Why don't you just read that over quick? Let me know if you have any questions, and then if anybody wants any more information from the last time I was here last month, just ask me and I'll reiterate what we talked about.
So the sick days would be like July first, January first or something, or the wellness days, it's usually like July first, January first.
Yeah, so, but it could also be, so let's say I'm capped on sick time, and.
I'm talking the wellness days.
Right, yep, but that's also for if I'm capped.
Yeah.
If I'm capped and I use a sick day in January, then in February I get that 12 hours back, so I'm capped again, and I don't use a sick day from March to September, that's a full 6 months too, but I can only get it once then, because it's not from January through June or July through December. But if I do go a full 6 months at the cap without using a sick day,
The start date's the date to the cap date.
yeah. But I would only be able to get it one day that year, obviously, because I started March.
So you have to have the full time.
Yeah.
I'll make a motion to approve. See what that letter.
Motion is.
Can we change the negotiated item?
What's that?
Can we change the negotiated item?
This isn't currently in our contract.
No, it's gonna be apparently.
Yeah, we can do side letters mid-contract.
Yeah, a couple other guys around here told me if you do this for these guys, you're gonna be seeing me too, they said.
And I think what this committee or the county has to realize is how many other county entities operate the way the sheriff's department does.
Like what?
Well, so for us, like I presented last time, when we have one person calling sick, that costs the county $1,300 to pay that person's sick leave and then to force someone in on overtime to cover that shift. $1,300 for one sick day is a ton of money. all I'm trying to do is try to get our
I
employees
know what you're trying to do, I felt the same way, cause I always had.
stop using sick days. But I can see the realm that they're looking at is, well, I'm capped, I'm a good employee. I haven't used sick days for years, but I'm getting it taken away.
So if somebody else had an idea that benefits employees that doesn't cost the county money, I'd be interested in listening. I don't think this will save us money, but I also think it'll cost us money.
First things first, I do have a motion on the floor.
Oh, yeah, sorry about that.
Is there a second to the motion that's on the floor?
I'll second it.
Okay, now is there further discussion on a motion that's on the floor?
Yeah, sorry about that, feel pretty good.
Phil, have you got any? And I know we went through some of this last meeting, but I guarantee you there's a whole lot of stuff been pumped in and out since last meeting. Have you got any estimates, any figures that show, I mean, we're talking, an employee could wind up with $600 in their HSA.
Right.
Any estimates showing us what this could cost us, what this could save us on, you know, with paying the, you know, $1,300 a day for someone that's on sick leave and you call someone in on overtime. Okay, that just put $600 in two people's HSAs if this works out as proposed. Any idea what, the give or take would be, or the cost to the county, or the savings to the county?
So I guess we won't know until we try. So like, I know right now that, like we said last time, there's only 6 Rusk County Sheriff's Office employees that are capped. And if they remain capped for a full year, it's gonna cost the county $3,600. I do know that we have employees that are in that 800 to 900 hour range that I've heard them say before, well, these people are capped, they're losing that benefit every month. Why do I wanna reach that?
Yeah, here you
And I think if we would be able to give them some sort of incentive to not have that mentality of, well, why do I wanna get there if I'm just gonna lose it? If we can give them something like, hey, all right, the county's gonna give me something for being a good employee, not using sick time, I wanna get to that 10-20.
But they're also incurring that liability with that course, so I don't think it's a savings on that plan. Because if they don't use it, they still have it in their bank, so at some point they could use it.
They're gonna get the 12 hours each month, so it's still gonna cost the county, but once they get capped, it's gonna be a lot cheaper for the county to pay that $50 a month in the HSA than for them to use a sick day.
That's what I just run it on a calculator, and that $3,600 that it would cost the county, that's 2.76 sick days in a year. How many are used in a year, Phil?
Oh, hundreds?
Hundreds,
Hundreds. We had the numbers last time,
yeah.
and they're on my desk, but hundreds.
Can you pull that up in a payroll spreadsheet? Do you have that? Or I can like,
It's my computer download in here.
I would say on average per payroll, we probably have 5 sick days per payroll.
So
Yeah,
about
5 to 8.
5 to 8, yeah.
So roughly 65 to 800 bucks a payroll is going to pay somebody on sick leave and bring somebody in on overtime.
Correct. Yeah.
What employees it says employees, what are we talking here? We talking administrative staff, we talking deputies, jailers, what are we talking here in
Whoever
the first paragraph?
Whoever follows the Rusk County Union,
And that pertains to which employees?
That would
In the
be-
sheriff's department?
that would be patrol, investigations, jail, dispatch, jail administrator, and me, not the sheriff. And no, I'm not capped.
I understand what you're doing here, but I don't know if holding a $300 carrot is gonna be the answer to what you're trying to accomplish here. for 6 months, is what I'm referring to. The other question I have, when you schedule wellness days, what's your thought process behind scheduling wellness days? Let me reword that. So that you can do these effectively, so that they don't put a strain the same way sick days were.
So a lot of agencies offer this kind of benefit to their employees. We can do wellness days a couple different ways. We can say you can only use a wellness day or those wellness hours if it doesn't create overtime. Or you can only use wellness days or wellness hours if somebody else doesn't have to get forced in. So let's say today we have a 3 p.m. car, which is a sergeant, a 5 p, and a 6 p. That 6 p.m. car, let's say they had 12 hours of wellness to use because they accumulated it last year. If they want to use that and not have to force somebody in, they can use it from 6 p.m. until 3 a.m. because that's when the sergeant goes home. We have to have 2 guys on. So they couldn't use it for a whole shift.
So they'd have to come in and do part of their shift.
Yes, they still have to come in.
But that's providing, unless I miss my guess, Bill, I don't totally know how you're structured. Providing you don't have something major happen in the county and you would call an extra or 2 extra deputies in any.
Correct. And that's also provided we're full staffed and we don't have to call somebody else in.
Okay.
But there would be several times throughout the year that they could use a wellness day and not create us having to force somebody to cover their shift. They would just have to be specific and pick and choose. It wouldn't be like, hey, I'm taking a vacation over 4th of July, I'm using 4 days of vacation, and then I'm gonna use my 1 or 2 wellness days on the days I'm supposed to come back, because that might require us to order somebody in. So it'd have to be, they'd have to watch the calendar, and they still would have to kind of be picky and choose about when they're able to use them.
Okay.
Because we're not gonna order people in to cover their shift for a wellness day.
So that's something that needs to be defined maybe in here, how the wellness state policy works.
100%, yeah, this is a draft. This is just a draft so you guys could see what it would look like. And I can specify more on how they can and can't use wellness days.
Roughly, if their figures hold true, I just took an average and didn't take nothing exact, it went to $7,000 on a pay period, which is gonna fall somewhere in the middle of where they said they're at. That's $168,000 a year. For us to pay out $3,600,
Where are you getting that number from?
what's that?
What you just said?
If we paid out ballpark $5,000 to $7,000 per pay period.
Right, they said there's, okay, Jim, they said, get my calculator back up here. He said there's roughly 6 to 8 sick days per pay period. Well, at $1,300, if you take 8 times the 1,300, that's $10,000 per pay period at 8. The 6 is 7,800, so I figured low, I guess. So if you refigure that, go on the low end, times, there's 24 pay periods, it's $187,200 a year that's being paid out between sick leave and calling somebody in on overtime.
Except,
It's not, I mean, it's not gonna save us that much money though, because it's really only the people that are capped.
cause if they don't take it, they're accruing that liability, so there's a bucket.
Right, but
That could be used at any.
Yeah, cause
But a lot
there
of
might be
them-
6 sick days taken, but maybe only one of those people was capped.
right, but no, Jamie, the wrong point there. The people that are capped are the ones that are gonna get the $3,600. But the ones that aren't capped are the ones that are using their sick leave, so if there's a carrot out in front of them, maybe them people won't use the sick leave. It's the 6 that are capped that's gonna cost us the $3,600.
Mm-hmm.
We're talking about the ones that aren't capped, that are, according to Phil, using sick leave, because if they do make the cap, they lose it.
we're trying to give those people an incentive to not use sick time.
I get what you're trying to do, but I don't like it. I'll just say it. I don't like giving someone an incentive not to use their sick days. They're entitled to them. How they use them is how they use them. It's a burden of any business, whether it's county or private sector.
And I agree with you, sick days are very protected. I can't harass an employee that I know is using sick leave and abusing sick leave. We've put some things in place that we've tried to, kind of rein it in. But we have several, I'm sure other places do too, but I know we have employees that use sick days when they're not sick. And that happens all the time. They use a
But then
sick day.
That falls under PTO.
They use a sick day because they don't wanna come to work.
But what does PTO mean?
We don't have PTO.
They don't have PTO,
It's treated the same way, is it not?
not by their contract, it ain't, because they're separate from the rest of the courthouse employees.
Is there stipulations in there that if they take a day, they have to be sick? Or can it be treated as personal time
No,
off?
if they use sick time, they have to be sick.
Okay.
How you can verify that?
Right.
But you just
Are
heard,
you- are
you
you-
just heard you can have a migraine.
Are you set up, Phil, that, over 2 days or over 3 days requires a doctor's
Yeah.
note or something?
3 days or more in a row requires a doctor's note. So our staff, patrol and jail, work 4 days on, 4 days off, 4 days on, 4 days off. So we always have a Monday and a Friday. My Monday might be Wednesday, and my Friday might be Saturday. But if more than 3 times in one calendar year, an employee calls in sick on a Monday or a Friday, I require a sick note. So let's say they took a Monday off in January as sick, they took a Friday sick in March, and a Monday sick in September, that's 3. Any other Monday or Wednesday they use sick time, I request a doctor's note. What they're doing is they're trying to extend their days off.
And are you seeing a lot of that?
I've just
We have
requested,
5 people who turn in doctor's notes.
You will see that, you know that.
What's that?
You will see that, you know.
Well, yeah,
this year we have 5 right now that are required to turn in doctor's notes for that.
Keep in mind the people that benefit from this the most are the people that are maxed out, so they've spent a lot of time coming in, whether they feel good or not, filling up hell or high water to protect the community.
No, this is a different subject, but I have no problem with this here, but we're gonna have to do something with the guy, for regular health, it does get maxed too, though. We may have to do something with them.
With the what?
It's nothing to do with this here, but we're, regular people that get maxed, we may have to do something with them.
But I think what you have to look at too, before you feel obligated to do that, is if those other entities, when someone calls in sick, is the county forced to fill that person's position that day, and you're not.
Also, if this is a cost neutral solution, so if they have a cost neutral solution that benefits their employees, I'll listen to it.
I can tell you what's gonna be in here next. Highway and Health and Human Services, we already do on-call pay for them on the weekends, so they're gonna say the same thing.
We just up their on-call pay, I believe, right?
Phil, maybe a lot of lying here.
Probably.
Gee, thanks for the vote, Con.
Hey, we got a place upstairs.
And let me finish before you answer, cause this is gonna be about a 3-part deal that I'm gonna throw at you.
Take some notes.
Have you got, and I know you ain't got no proof or nothing written, but in your own mind from what you've seen, how much is this gonna actually help, or how much of this is falling under the entitlement that we're seeing with some of this younger generation that, well, you know, don't wanna work, they don't wanna be loyal to nothing? So have you crossed that bridge in your thought process?
Yeah, so we've talked about that. So obviously the people that are maxed out on sick time right now are pretty tenured people at our department, because it takes several amount of years to get capped. I have heard several conversations amongst people that have been here for 7 to 15 years, and those conversations have been, well, why do I wanna hit that cap? I don't wanna hit that cap, because then I lose it. But that's why this will hopefully help them reach that cap, because they're not gonna lose it. They're still gonna receive a benefit for being a good employee and not calling in sick and not having to force somebody else in to cover their shift. The younger people, the ones that you referenced, they're not even close to being capped yet. They have 50 to 200 hours banked, 50 to 300. They're a long ways away from that.
And they typically are not the ones who are abusing.
No,
their
the
sick leave.
younger
It's our
ones,
most senior
they're coming in
people who
work.
are doing it.
Okay, well, you answered my question.
Because
I
what's
appreciate
really
it.
important to the young ones is they want that money. They want that money, they want that money, they want that money. They could give 2 rips, the young ones, if the county offered them health insurance at all. We have a young employee who does an excellent job, comes to work all the time, doesn't even have health insurance because that employee doesn't want health insurance. But that's the younger generation.
You want some money?
It's gonna cost money
Yep.
to have the health insurance, so they don't want it.
So if they take a sick day, that's an unpaid sick day or a paid sick day,
Paid sick day.
It's paid.
they still get the money if they.
Yeah,
Same token, he doesn't have any insurance, something happens to him, we're gonna be picking up the tab for that too.
well, not really, cause he doesn't have any insurance.
We'll be
At
picking
all.
up the tab.
No, we're-
Human services.
Well, no, actually, somebody's gonna file a judgment against him, or he's gonna lose everything he's got.
The other side.
Answer your question.
Yeah, you did. Phil, if this was to pass, I'm not insinuating either direction when I say this. At the end of a year, and this don't change, then where are we sitting?
Your question is if this passes through the county and we're able to introduce this slide letter into our contract and we revisit this in a year or 2 and notice that there's no change, where do we go from there?
All it did was cost the county $3,600 to the 6 guys that are maxed out, and still cost us $180,000 a year for guys using the sick leave.
I think we revisit it. And if it's not doing what we intended it to do, why continue it?
You have to revisit, cause this only goes to the third.
Correct, it only goes till December 31, 24. That's when the contract renewed.
So that'd be incentive for them to make it show us that it works as well.
Correct. So, and if this passes, obviously it's not gonna pass this month and not go into effect, but, we would have roughly 12 to 14 months to see if it is doing what we want it to do.
Are there any further questions on the motion on the floor?
So, I got one more thing here. So we discussed making a change here, or how the wellness days are going to be used. Are you gonna pass this the way it is? Is that what we're thinking, without making that change?
So it's a draft to incorporate that as final one.
Okay.
I can add in there, restrictions on how the wellness days can or can't be used.
That being said, I almost think I'd like to see an amendment to the motion to incorporate that. Bring it back next month.
Oh, to add the trip. You're gonna bring this back next month, you're saying with the final one?
I'll come back for a year if you guys want me to.
Cheers.
I can add, into the paragraph in lieu of payment, I can add onto there that, employees are required, if they wanna use wellness days, that it can't create overtime for the department, or they can use it if somebody else doesn't get ordered to fill their shift. And that'd just be a sentence, is all I add in there.
Clarification of holidays, and these are how it's.
If we don't, it can semi defeat the purpose.
All right, yeah. Like I said, it would be a sentence that I would add on to that paragraph.
Maybe I would, not what you want on it.
Yeah, I think so. I mean, besides Alan's signature.
Well, no, for the defining the wellness days.
Yes, I would just add in, like I said, restrictions on how they're used.
We don't see between 1 and 2, another 20 or something defining wellness days, or.
Well, I can just make that in lieu of paragraph 1A.
Maybe you had something now where we can pencil that, otherwise we're probably put it to next month.
I could type it up right now and email it to you guys.
Or if you tell it to us, I can pencil it. But I agree, I think that should be the.
Why don't you just make the motion to amend it?
Right, that's what I want, again, if you have something to amend to, I don't know what I wanted to amend or what. Makes sense.
Let me get my typing fingers out.
I got reservations, but we went to on this, on the rest of the people that are next to them.
So how about, Brenda, wellness days may only be used when they don't create overtime for the department? Yeah, it's basic. So wellness days may only be used when they don't create overtime for the department.
And then I imagine you want, some kind of notice, like minimum 2 weeks notice or something, I don't know.
It'd be the same as our vacation request is what we do now, you have to give a 14-day notice. Otherwise, you have to find your own person to fill that shift.
So is that kinda like how comp is used, cause can they only use their comp time if it doesn't create?
No, they can use comp for anything.
Like vacation.
The only thing different between our comp and vacation is vacation supersedes comp.
Making that as an amendment then, Jonathan, the way I understood.
Yeah, when I get it, I'm gonna,
Let me get you something.
alright, so I'll make amendment to add to the end of 1 in the lieu of payment paragraph. Wellness days may be only used when they don't create department overtime. Request to follow vacation policy.
Request what?
To follow vacation policy.
Does that sound fair?
Yes, but I'll put it in writing here and I'll email it to you guys. Is that what you want?
Not quite reading my handwriting.
That's what I thought.
Okay, there is an amendment on the floor. Is there a second to the amendment? I'll ask one more time. Is there a second to the amendment? The amendment is gonna die for lack of support. We're back to the original motion. Connie, would you read that back?
Motion by Jay Undershoots, second by Rasak to approve HSA contribution wellness day incentives when sick leave maximum is reached.
Is there any further discussion or questions on the motion on the floor? None being heard. All in favor signify by aye.
Aye.
Opposed?
No.
Motion is defeated, Phil.
Okay. Here's a question for you guys. What if I took, so we obviously have paragraph 1, which is section 10.06. Then the paragraph below it. What if you took out the first paragraph? X it out. get rid of the HSA comp, and we'd only be looking at wellness days, which would cost the county nothing.
Any comments, any questions?
I'm fine with the original, I'm fine with that one.
We'd still be giving people an incentive to reach that cap. And we'd still be giving the people that are at capped benefit because they don't call in sick.
How exactly will wellness days work? Do we have anything like that throughout the rest of the county right now?
I don't, but maybe.
And if we did, how could we make them work? That's my real big problem with this. And I don't think it's right to do it for one group, not everyone.
I mean, for the general employees, it'd basically be like an extra PTO day.
I mean, it has to be treated as PTO, like you just said.
Yeah, I think that it would be PTO except that.
So there's still gonna be a dollar value associated with it.
Well, potentially, depends on if it's a salaried person covering the shift or if it's a sergeant that's already on or, that's something that would explain better, but it would essentially be like PTO for them, except that there would be the caveat of it could not incur overtime or additional wages. Would that give the day shift people an advantage over the night shift people, because the night shift people, there's not as many available to cover.
Well, so like, let's say tonight we had a 3P, 5P, and a 6P. That 3P could take 12 hours of vacation, because we already have a 5A and a 6A, and a 5P and a 6P. The 3P can take it whenever, but the 5P and the 6P can only take it if that 3P car is working. But they still could take 6 to 9 hours at a time. They might not be able to take the whole shift. They could take the whole shift. The 6P car could take their whole shift off if they wanted to, as long as the 3P car agreed to work their 6P shift. Because the 3P car is already working, he would just start 3 hours later.
And would that incur overtime
No.
because they'd be working?
The problem with this, Jim, is you're talking apples to oranges here. Because the regular courthouse employees don't have said sick leave time, they have just PTO time. Where the sheriff's department employees have said sick time and said vacation time. The said sick time is paid by us when they call in sick. The courthouse employees, whether they use it to do something with their kids, use it for a sick day, whatever, comes out of their bank. Where the sheriff's department comes out of our bank on sick leave.
We're paying for it either way.
Right, but what do you mean you're paying for it either
Still
way?
a cost to the
It still
county.
costs, whether it's sick or vacation.
No, I understand that, but I'm saying, you guys don't have sick leave days, you have PTO, correct?
Correct, there's people that start with, might get 3 days in their first year, 4 days in,
Four, if it's a half year, four days.
okay. So they could get 4 days in their first year, but the sheriff's department employees, they get a day of sick leave per month
Correct.
after that. So they could end up having more sick leave available to them in a year than a general employee has for PTO, and that's your vacation and sick time combined.
So there's a benefit in their contract right there compared to the average county employee.
Correct.
They're already different.
Right.
We're just modifying how they're different.
We can only take sick time when we're sick.
Theoretically.
Well,
But I probably.
Or less than 3 days.
If you, on the same token, to do it for the general courthouse employees, you would have to add a day or 2 days, however, whatever it was, of paid PTO time.
Well, but if they're taking it in lieu of worked wages, then that really wouldn't cost the county any more money for the general employees. As long as they're getting their work done, you know, like, if we're not paying for somebody to cover them being off, if they, you know, if the general employee's got, like, say, a wellness day too, as long as it doesn't incur additional costs to the county, you know, somebody in my office is off that day, well, I'm still there to cover it, so we're not having to necessarily pay for somebody to fill their spot.
And that's in your logic there, Jamie.
Well, I think you were saying that it wouldn't cost the sheriff's department more money to give the wellness days, and by that rationale, it wouldn't cost anything for the general employees to have wellness days either.
I guess if you feel you have enough extra staffing to cover that though,
Well, if we're talking 2 days a year.
per employee,
Right.
when they start adding all the departments, I mean, the question I'd come back with is then are you guys overstaffed?
Well, if it's 2 days per year and it's within each individual department, and that's if they're not using a sick day.
Your morale's gonna take a hit.
That's.
Everybody says they don't have time, which I don't disagree, I believe, but then if you're saying we got all this extra time we can take off,
Well, a few years ago, we changed the PTO policy where people got, they accrued PTO faster. I mean, it's the same argument could be made about that.
I guess my point is, though, Jamie, if you add a wellness day to the general employees, what benefit is that to them?
For the employees?
Yes,
It's another PTO day.
okay, and my point is, then the county has to ante up for that added day.
no, cause it won't change their wages, it'll just change how much time they're at work versus at home, for the same wages.
And there'd be similar criteria.
Oh,
as to
okay.
the sheriff's department, they would have to be maxed out in their hours
I
to
see,
qualify.
okay, I see what you're saying.
Qualify for it, et cetera.
How would a county employee receive that 1 or 2 wellness days? Like, what would they have to attain to reach that 1 or 2 wellness days?
I would say
The
the
same as you.
So
They're
what's
maxed out on their extended leave bank.
maxed out on PTO, or,
Their extended leave bank.
and what is their extended leave bank?
If you don't use your PTO rules.
No, what's the cap?
680 hours.
680, so it takes how long does it take a county employee, a courthouse employee to reach the 680 hours?
It depends on, where they start with their PTO level, but if they don't utilize any PTO, it could take 5 years.
So it takes 5 years, it could take 5 years to max out if they don't.
That's not using any vacation,
Right.
it's not using.
Right,
any-
I'm saying, I'm curious on how long it takes us to max out on sick time if we don't use any sick time.
Wasn't it like 12 years? Okay, but you can also accrue more, so your retirement benefit is more generous.
It would be a little over 7 years.
7 years?
But that, they would still be able to use PTO in that time too. Unlike if it was a general employee, they can't take time off for any reason, whether it's sick themselves, sick child, doctor's appointment, vacation. So in all reality, nobody's really gonna make that 5 years.
It's just not apples to apples comparison, like Terry said, it's different, completely different, cause they have a whole different system.
We used to be that way.
Yeah, but the problem with that, Jonathan, is the general population of employees is not gonna look at it that way. We give it to one and not the other.
We're already doing that, they get 10,000, 20, and they get 600.
Right, but you're gonna create that much larger of an uplift, believe me.
Does this committee at least understand and agree with me when I say that the sheriff's department is very different from other county entities? Because other county entities don't get called into work at 2 o'clock in the morning on Thanksgiving.
Oh, yeah.
Certain departments.
Yeah, certain departments.
Who's that?
HHS.
But
or
HHS, they have someone on call.
HHS highway,
But HHS
they
has
may
one
still
person
have
on call, right?
but they're not scheduled, correct?
They're being paid to be on call.
Maintenance.
Right, but they also can't go have dinner with their family if their family is more than 30 minutes away.
Right, but they're being paid.
Yes, maintenance, I forgot about maintenance.
Well, they're being paid 1 or 2 hours. Or 2 or 3, I suppose.
To most of the time, not work.
But you are the only one, and I think everybody understands that you're mandated to have 2 or 3 or 4 people on duty at all time. If one of them calls in sick, you're paying the sick leave, plus you're calling somebody else in to cover that mandated number out there. But that even being said, Phil, the majority of the general population don't understand that, so if we give to one and not the other, here comes the flood of an uproar.
Can you blame them?
Well,
You know how they're gonna see it.
I don't know how they're gonna see it.
Anybody got any ideas?
I get what he's trying to do. I understand it. I just wish there was a way around it.
I think the only way around it is just incentivize it.
Say that again?
The only way around it is to incentivize it. I mean, there has to be a reason for an employee to want to reach that max. And right now there isn't, because they know they're losing it once they reach that max. And nobody wants to lose benefits.
I went through that, I know what you're talking about.
If we was to do this across the board, both here and general place and courthouse, what could we save for this county? It's an added benefit that really don't cost the county for the general.
No, and he's right, in most areas, I'm not gonna say he's wrong, in most areas, is there a burden to a department because, in most cases, because someone calls in sick that day? The other 4 that are there, or 3 or whatever, pick up the slack and move on, where theirs is a different scenario. Not gonna say he's wrong on the points that he presented.
No, I totally agree. I guess I'm looking at my mind in a way to try and fix this.
Right.
But if you did what you did all across the board, we already had a highway guy because they said they're too busy, they need an extra guy. Well, now you add more days off, they're gonna need more people. We added an IT guy because IT people needed another guy because they were too busy. So we wanna give people more time off while they're being paid. I mean, I'm all for giving people benefits, but on the other side, it's not gonna cost savings like this or cost neutral anyways.
I don't know, cost the county a lot of big money here last fall, when one guy hurt his leg or something, he had to go get surgery, and nobody to run the hot mix plant.
Right. So you wanna send that guy home or we need the guy running the hot mix plant?
Oh, we didn't have anybody else around.
So let's keep them around.
Yeah, but Jonathan, if you put some of the same criteria into this that we was talking about here, you know, that it don't infringe on, for them, it would be calling somebody else in. For something like highway or maintenance, it would be, you know, and I don't think maintenance it would. Highway would be probably the only one that you would, where it could hamper a job. But this isn't something that they can just call in and take, this is something they have to schedule. So that can be scheduled on days when they're not paving or not doing shoulder or something, you know, which.
We're gonna go, people wanna add more jobs because we're overbooked and overloaded, which is probably true. But then this is gonna make it more overbooked and overloaded.
Okay, so then what if we flip back to a cash incentive, which I think most people would prefer rather than another day off?
It's like for the general employees, those that are maxed out on their extended leave bank aren't gonna benefit from a wellness day, cause if they can't use their PTO, they're not gonna be able to use a wellness day.
Why can't they use their PTO?
Because their workload doesn't allow for it. Or they just, we can have a conversation about this another time.
So what's the cost neutral plan, and I would,
Well, we're in a similar boat, we have a very few amount of people that are maxed out. And I think giving them an HSA contribution, which comes out pre-tax, that's another benefit, would be better than offering a day off, as you're saying, if we're all so busy.
well, I don't doubt that everybody's busy, I don't see too many people anyways that are twiddling their thumbs, so I don't doubt that. But, so, like what you guys saying, develop a little bit, then next month, like, set out, listen to, other,
You want hard numbers?
well, I think you have to ballpark, like that, but,
No, they're pretty hard,
okay, give us hard numbers.
because we've got a set number of people that are maxed.
How many is that, roughly?
We could come up with like 4 off the top of our
So
head.
10 total in the whole county,
Exactly.
so we have 6.
You know, if somebody's these people in the county they're like the hardest working people, and I think it would be,
That's why they're maxed out,
exactly. And I'm not gonna say names, but they're very hardworking and they don't take time off because they constantly take on more work, and I think rewarding them with a pre-tax contribution to their HSA is the least we can do. Okay, you'll have it.
Well, if we can benefit people without costing money, I think I'm for it.
Okay, well, there's gonna be a little cost. Nothing is free, Jonathan.
Little cost, but it's free.
I said nothing is free, but there's a little cost.
We're up there if we can do a cheaper, low cost benefit, I mean, cause we can't out-compete everybody with the strong county on wages, but if we can compare benefits.
But you,
Every little benefit that this county can offer is going to help separate us from other counties. You guys have all heard it before. We've had several people apply for us, and they've said, I was willing to take a pay cut, but I can't take a pay cut and a benefits cut, and that's what I would be doing here.
And one other thing I'd like to add is that when the wage study was going through, a lot of people had complaints that the county doesn't seem to recognize or appreciate longevity. This is a longevity benefit.
oh, and Jonathan, you talk about cost neutral.
We diddle up some numbers for you.
And I'm not so sure, Jonathan, that you're gonna know how cost neutral this is unless we try it. Because if this actually does work for the sheriff's department, there could be a $60,000-$70,000 savings. Well, if there's 10 people in the whole county, that's $6,000.
Yeah, but the thing is if you're an 8-year guy, you have 500 hours in your bank. So you don't call them sick, it goes to your bank, right? So it saves you the overtime cost, but you're accruing that liability that's sitting in your bank, so you gotta account for that as a cost. So it's not a true savings until you have a payout at some point when they retire or whatever. Or they take that $50. So down the road, it might have a cost. Cause you're adding a liability, right?
Yeah, I get your point.
Well, would we be adding to the liability though? Because it would be only if they met
Their
that
sick
cap.
bank is increased, but he's talking about people who are not meeting that bank, but not taking.
Or offer a
sick
payment
leave
in
to them.
lieu of going
Yeah.
into their bank.
So you're still accruing, you can't really count that as a cost until you've maxed out.
When you say liability, what are you talking about?
So if you have 500 hours in your bank,
Mhm.
and you say, hey, if I get to 10/20, I don't, I can get the $50, so you don't take the sick day that you'd already take. If you take the sick day, you don't put an extra 12 hours in your bank, right? You take 12 hours out of your bank. So you keep increasing that bank from 500 to say 10/20.
Yep.
That 10/20 hours is a liability to the county on paper and.
Because you have to pay that out when we retire.
Right, because there's 2 people retaring in January, that's gonna be almost $40,000.
Yeah.
But here's,
It's a purchase of liability until they pay it out, then you stay with half with the overtime, the 50% overtime.
because we get to cash out 75% of that.
Oh, you say 25% on that.
Yeah, but my question to the county would be, how many people actually retire from Rusk County? Like, how many retirements do we have a year?
It has to be under half a dozen, doesn't it?
Yeah.
Yeah.
So what happens if they don't
Very few
retire?
people retire from Rusk County. Like, I know in law enforcement, people don't retire in law enforcement from Rusk County. Now, obviously Eagle and Zelk are gonna retire next year, but they were born and raised here. But I think in the 8 or 9 years that I've been in my position, Debbie Flater is the only person that has retired from the Rusk County Sheriff's Department. That was before.
So what happens to the sick bank if they leave for another job?
County keeps it. I could be a 25-year employee here, and I could quit law enforcement, I don't get any of that sick time, because the county says I have to be retirement age.
Is that the same for the whatever bank you talked about?
Yes.
What do you call
You
it?
retire under the WRS to get 75% of your
Retire? Here?
You leave before you retire?
Right here.
You get nothing.
None of
Look
it.
at this, yeah, one's
So I
right
could,
here.
I could give the county 28 years of my life,
31.
31, but you retired, right? I could give the county 28 years of my life, and if I'm not retiring, I lose all that benefit, because I didn't retire. So very, like I said, very few people actually retire from employment at Rusk County, because they go somewhere else to make more money and get better benefits.
Well, our benefits plans changed a lot to when Act 10 came along, and that's where it took that hit that you're talking about. At one time, we had really good benefits.
We did.
Kind of knocked it down.
So you say there's roughly 4 other employees within the county.
We
I
can do-
guess when you look at that, I'd also like to know how many are close.
Okay.
That maybe could be there, but use some hours for this or that. I don't know exactly how PTO works here, but did
Like
they
within
use some
10%?
hours? And they know they're close to their max, but they use them for this or that type scenario, to stay just under their max. I don't know. Look at the, you know,
Well, they're gonna use the PTO because that's their vacation and everything.
well,
Grievance pay.
Right.
Rosemary and that.
so I mean, if there's quite a few people that have been here 15 years and they're flirting within 50 hours, well, they're using some here and there because it's their right to.
They don't wanna lose it.
Probably the difference is you're not covering up time and a half. Right?
I mean, this
The
isn't,
department, they're recovering somebody at with time and a half hours. Whereas the county people, and again, I mean, I wanna hear what you guys have to say, but the county people, no one's replacing, covering for you at time and a half wages. So that does make a little difference when you do the numbers.
So we would get $75 a month there, county closing.
now, does it work that way, what Phil just explained for the sheriff's department, if they retire before retirement age, does that also happen here for court employees?
Yes, so if you, like, for instance, we had a highway employee who just quit. Okay, so he was paid out the rest of his PTO for 2023. He had a significant amount in his extended leave bank, which was not paid out because he didn't retire. So current year PTO paid out, extended leave.
But if you were in the private sector, you wouldn't have gotten that either. So it is a benefit to work in the public sector
It depends what.
if you ride it out till the end of retirement age.
So, but you're,
I did not, but my PTO is.
you're retired,
I got
but
my
it's different,
years,
though,
so.
too. Well, technically, that's retired, it's fine, correct?
No, I didn't get any kind of rollover. Let's use it or lose it.
When I did the calculation in April for the, cause it's as of
You gotta have so
March
many hours,
31st, whatever,
how many years into it?
you have left from your
30 years.
PTO, those years, and then
2 years old.
15
Is max.
people had over 600 hours in their extended leave bank.
How many, Jimmy?
15
I think you had over.
yeah, the cap is 680. So of those 15, 8 of them were at 680. So but the other 7 are over 600 hours. So they would, could easily hit it that year. And of those people, 2 of them just lost, like one of the people lost, over 3 weeks PTO that just, their bank is full, just wiped away.
People gave back PTO to the county.
One person over 3 weeks, another person 2 weeks. So of those 2 people that are maxed out,
And there's
or
some
that
of
are, that
the
lost.
hardest, there's some of our hardest working employees, and that's why they have to give back PTO.
The problem with that scenario now already is if they're not using the time that they have, what good is it going to do to give them another day off?
That's why you
Right,
give
No,
them
that's not, we're
HSA.
talking about the HSA contributions.
Not giving them a day off and giving it
Putting a day off of, or whatever towards their HSA.
Right, cause I agree with you, if they can't use their PTO already, why would we give them another day off, that's kind of a slap
Now,
in the
what if
face.
they're not using our insurance?
I think that's another conversation.
Yeah, that's a different topic, that's down your agenda a little bit.
How many cans do you want me to open with my
Just,
fingers?
you can stop there. That'd be good.
I think Phil would let them come back with something. See where we can go with this.
I still think the HSA contribution is the best way to go, but I'm only speaking for the sheriff's office. Completely on board if the county decides to give it to all county employees. I mean, I completely understand that you guys understand that we're totally different as far as work hours and responsibilities, but if the county wants to decide to give it to the whole county, that's even better. Because we're rewarding not just the sheriff's department, we're rewarding all the county employees for being good employees and not using sick leave or coming to work when they're supposed to.
We gotta keep our morale up too, you know.
Yeah.
This county needs to do something, actually a lot of things, to help keep employees.
Exactly.
Okay, you got one more here, Phil. Hiring a patrol deputy pending upcoming retirement.
Or,
What are we gonna do with this thing?
They're gonna bring something back next month.
They are.
They are.
Alright.
Alright, what'd you have?
Hiring a patrol deputy pending upcoming retirements.
Okay,
Talked about this at our committee meeting this morning.
yeah, so it went to emergency services this morning, they recommended it and supposed to come here, so here's our current situation. We are we're not short anybody on patrol, we're fully staffed.
Excellent. For how long?
Okay, you're done, goodbye.
Hold on. So we're fully staffed, but our last hire is in the academy,
Yes.
okay?
He will be here when?
Well, the academy is done December 15th. But then after the academy, he still has to go through FTO for a month or two. So he won't be able to be by himself until probably February, okay? Fine, that's the first time we sponsor anybody. We have 2 employees who are going to retire anytime between January and April. 2 senior deputies. They both told me that they're retiring January, April. They haven't given me anything in writing, I don't know if they will. But we have a person that has applied for our department who currently works for either the Vilas or an Oneida County Sheriff's Office, who is certified. Our question to you guys is, can we interview this person, do a background on this person, possibly start this person in November? Vilas and Oneida counties use the same exact RMS system we do, Stillman. So the learning curve there would be 0. He has 10 to 12 years of experience. Learning curve there would be 0. It would just be learning our process. So in reality, we may be able to get this guy on the road by himself before our academy student is on the road by himself. Therefore, once we have those retirements in between January and April, we will incur no overtime costs to fill shifts because we'll already have him hired on the road.
Has he applied already?
Yes. We have not interviewed him because I wanted to get permission first to move forward. If he's good, he might not be good. He might have a terrible interview. He might have a terrible background. I don't know. But I wanted permission first to be able to move forward with him before we actually move forward with him.
Our patrol opening closes, I think, the 23rd. It's posted on the county website and WileyNet. We have 5 applications. He's the only one who's certified. The others have criminal justice backgrounds with school but have not gone through the academy. So it could be another potential sponsor opportunity, but we do have one who.
Because if this guy works out, he could be on the road by himself before Patrick Heater.
That's like a good move.
But
when you interview them, then you're gonna know more, right?
So, but understand too that for a month or 2, we might be overstaffed by 1 person.
So, until your retirement, you can.
Right.
Okay.
I don't have a problem with that, even being overstaffed for a month or 2, because it's good crossover. The only thing is, I'd like to see it in writing, because somebody could intend to. I mean, we had that, I've seen that in other places where you feel, that's good, I used to be proactive
between a rock and a hard place if somebody decides not to retire.
Yeah, right, and I've had that conversation with both of them. One of them, I don't think we're gonna get anything more than 2 weeks from, which is really unfortunate. The other one still doesn't know, I just talked to him today, still doesn't know when he wants to retire.
See, that's the
How many months retired, but not what date?
Right, I mean, it's going to be the first quarter of 2024, but like I said, one of them, I wouldn't be a bit surprised if all we get from him is a 2-week notice.
So you wouldn't get nothing in writing.
Okay,
I don't know.
I'm gonna put the monkey on your back. Either one of them retired, or one guy overstaffed, what step you gonna take?
Fire one.
Oh, he didn't even think about that.
They'd still be in their probationary.
We can fire anyone that's not probationary, period.
And that's gonna hurt.
We're just paying this guy to get the guy
What?
certified.
For our future recruitment, if they say, well, if they're overstaffed, they're gonna fire me.
We're never overstaffed, we haven't been overstaffed for 114 years.
We got any further questions for Phil?
I think we should go ahead and interview the guy and see what turns out.
Why interview the guy if you're not gonna improve all that?
Well, if he passes it.
I think you need to put a time limit on how long this is gonna go on before it has to be resolved, so it's whatever the probationary period is, you're gonna have to say he can go over up to so many months.
He's probably not gonna come, he ain't really got the job either.
I need permission before we interview this guy, cause I don't wanna waste his time or ours.
Do you have it in your budget?
What,
Adding,
for 2024?
no, for 2023, cause that's been the majority of the overlap.
But he wouldn't, well, he would be hired possibly in November of
Yeah, 2
23.
months.
So it'd be, I'm just thinking if everything went boom, boom, boom smoothly, it's the middle of September, interview background wouldn't be done till 1st of October. Earliest we would hire him would be the 1st or 2nd week of November,
Yeah,
so 6-ish weeks.
but even if we could have everything done ahead of time, we could give him a start date of 2024, 1/1/24.
What was this built into your 2024 budget?
No,
Did you say he's from Oneida County?
Oneida or Violets, he's
I
worked for
think he's
both.
Violets.
He's just part-time over there then.
No, full-time.
Yeah,
So he worked as a deputy sheriff in Oneida, currently he works for Vilas, right?
that sounds right.
And he applied for us weeks ago. We haven't reached out to him, so he might be like, I haven't heard from him, so
Gone already.
maybe. But I just wanted you guys to be aware that yes, there might be the situation where we are overstaffed for 1 to 3 months.
Or longer if they both back out.
I can't promise anything, but I'm very certain they both are going to retire.
We'll be overstaffed for 6 months. You can be overstaffed for 6 months, real easy.
But like, let's look at the scenario when one gives us, let's say one of the guys that's gonna retire, gives us a 2-week notice. Okay, and doesn't give us 2 or 3 months, or 4 months. We're down that shift for 2 to 4 months, filling it with overtime.
So what'd you do with all your money when you were short on employees? Did you bank that with our finance director?
When we were short on employees, we
Yeah,
filled
when
those
you
shifts with
couldn't- when you
overtime, which
couldn't
cost
bill
us
it.
more money.
Did you bank it with finance?
Yeah, you got it all, one lump sum.
Paid all the overtime.
But when we have a vacancy, it costs a lot of money,
Costs a lot of money to staff an extra person too, though.
not as much
Not
as a
as much as
vacancy,
it is to have a
because it's time and a
vacancy.
half.
Yeah.
Well, and you need to factor in burnout, right? So they've been working a lot of overtime this year, and if we don't start succession planning, they'll have to keep doing that.
He did.
What?
That's the maintenance guy fixed it.
Somebody knocks that shade down.
Here, there's maintenance here.
I was gonna buy some this weekend, but I didn't.
Maybe you buy your own blinds?
I didn't even pull on it, I was
I'll
twisting the
donate
thing
it
to
if you have to buy them yourself, I'll kick in for a couple.
What are you gonna say?
motion for, or we move on?
The light's shining on you, Bob. Lights on.
My head.
Could you do a background check without actually offering him the position?
No.
Can't.
No, we have to give a conditional offer prior to doing a background investigation.
He's already working, he should be able to pass that.
Well, maybe.
She stopped along the way someplace. I make a motion for that.
Motion's made to approve the hiring of a patrol deputy pending upcoming retirements. Is there a second?
Yeah, I will. I guess it'd be better to have over.
Well, you know, eventually somebody's gonna leave anyway, it's kind of a long time.
One of those two are, both of them are going to
Not
retire.
gonna be them, but somebody else eventually will leave it.
Well, and here's the thing too, I don't wanna be overstaffed, because we don't have enough squad cars to be overstaffed. So,
Yours, okay.
Yeah,
I
it's
suppose.
either you or Mr. Wallace, we
Yeah,
have
I'll-
to give one up.
ride my bike 26 miles to work.
We have some that look just like squad cars in the county fleet.
There you go.
There's a motion and a second on the floor. Is there any further questions or comments?
No, just as long as it's with the understanding that, I mean, we're gonna do it within the probationary period.
Yeah.
Okay.
All in favor, signify by aye.
Aye.
Opposed? No.
There's your new.
Motion.
That was a hard one.
Motion does carry.
Okay.
Like, I don't know.
I'm sorry.
So, as long as I'm on the same page, we're gonna wait for next month for Jamie and Ashley to present some numbers for courthouse general employees as far as how the HSA contribution would affect the whole county, including the sheriff's department.
Correct.
Okay.
Jeremy, or should I move on? No.
Yeah, Lynn's been here for a long time, can we do one of
Um,
You wanna sit through?
got a second.
Well, let's take Gary, maybe you don't wanna sit here all night either.
Gary who?
You wanna come on up here?
I guess I'm just here because I seen it was on the agenda, I don't know anything about it, but.
What's that?
Recruitment, lines. Just teasing.
Nothing personal, right?
Oh, good.
Actually, we're waiting for.
How about you, Dee?
What, are we moving to Lynn?
Oh, no.
No, number 3, Lynn said she's fine, she's, I think,
She's observing.
yeah, moving to number 3 until, because Jeremy is not here yet, so.
Yeah, I'm
Right,
texting
we're
right
calling
now.
him.
This, I'm not sure where this come from, approval of recruitment, hiring of an LD, decommissioning, and,
It came from the property committee.
okay.
Gary had asked for that at the last month's property meeting, for it to be filled.
I thought it was supposed to be on the following, that's fine, I'm fine if it's on this one, but it was supposed to.
What was on the property committee meeting? There's something else similar to this, right?
There is, yes. I was asked to put that on by Tony, and I did discuss that with
This one, yeah,
yourself.
I have not read property minutes, so.
No,
I'll
it's
pull him
agenda-
up for you.
What's that?
I'll pull him up for you.
the agenda.
No, I'm talking about the minutes, why this is on the agenda. Motion by Phil Schutz, second by Wedwick to approve the hospital project manager and forward to personnel. The minutes say Gary would like to have consideration to create an airport director, a hospital contact / project manager should also be considered.
Okay.
Yep. I guess I've been doing it, I mean, I thought it was gonna be on the next personnel, cause I thought it was supposed to go to property again, but, since
should we just do?
Well, we can do it, I don't care.
It's up to you. Terry, I guess.
I mean, if this is,
You're ready to go.
somebody in mind, is it for you, or what's,
We
I'm
briefly
lost.
talked on this a few months ago, didn't we? And then we held off.
Wasn't there a
Right, so
resolution?
there's a resolution that says if we need a project manager for the hospital decommission, the property committee will have the authority to hire that person only if personnel signs off on it.
Okay.
So it was brought to property at the August 4th meeting, and Bill Intershoots and Wedwick approved hiring the project manager to forward to personnel, because you guys have to sign off on it.
Okay, so they're just,
And then still has to go to
property is
board.
asking for our authority to do it,
I
then.
don't think. it
Nope,
has
the
to-
resolution says that you guys can sign off on doing this, and then property will serve as the hiring committee.
Let's sign off then.
And it's already went through the county board, we got past the county board, correct?
Yeah, that's what the
That's where
resolution
the-
went through.
That's what I meant before. Okay, so the board approved that. Yeah, okay.
I guess I would entertain a motion then to approve and pass back to property committee.
So here for the minutes for the next meeting, it says approval of facility manager stipend for decommission and demolition project manager.
I guess I've been doing it the whole time, so I guess I wanna get paid for it.
Do you wanna get paid for it, or you want us to do somebody else to do it, or what do you want?
Well, I guess I've been doing it, so I wanna get paid for it, I will do it if you guys want me to do it the rest of the time, but I wanna get paid for it, I'm not gonna do it for free.
Now, is that up to us or is that up to property?
We sign off.
A stipend needs to go through personnel.
Forward it on, property would have to forward.
Right, property would have to forward the stipend on to personnel. It's up, personnel needs to sign off on me advertising for the, project manager. So if you authorize, yep, go ahead and hire somebody, I'll go ahead and post it tomorrow. And then property will serve as the hiring committee. If that makes sense, instead of like an ad hoc hiring committee.
Okay, because is that what property said, it, not a stipend then?
Right,
They
so,
wanna hire a project manager to do it.
correct, so.
So
on
the stipend
August-
is off the table?
Well, hang on though, don't say no, cause on August 4th, a stipend, at least in open session, was not presented to property. This motion on the open session is to approve the hiring of a project manager.
Which
There's
the
no motion
hiring,
for what stipend.
the hiring of the project manager could be Gary, or it could be somebody else. They haven't come to us with a dollar amount for us to approve that.
Yeah, so how do we
That's in
really?
the, hang on, that's in the resolution at $50 an hour,
I'll go mine down.
correct?
Okay,
Almost sounds like this needs to go back to property for clarification.
Well, I feel like that motion was clear. I mean, I was at the meeting and that was the motion that was made, that
Is the resolution $50 an hour or up to $50 an hour? Because if it's left vague, then property's gotta put a number on it.
No, with a pay rate of $50 per hour to be funded with wind down funds.
And no hours, no max, no estimate.
Well, hang on, there was a job description, let me see if it said in there. No, not that I can find.
here's the resolution right here, Jim. No.
Oh.
You're-
Okay.
Right there is no hours on it or nothing. On the county board, it's $50 an hour. That's it. Yeah, if you get a bigger brim on your hat, Bob.
Yeah, no kidding. Well, not gonna wait.
What happened to the shade?
Phil
What did
Grassman.
they do to the shade?
Don't mention the shade, Terry's very touchy about that.
You just.
Wait, why don't you
wait,
get
shut
the
up,
price?
Jamie back us down.
It's always key to pay the stipend to, Heidi.
He's got a break it. He's gonna break it.
No.
No, I fixed it.
So what's quick on you?
I ain't broke it.
Remember what it was?
Pretty bad.
What's that?
Stipend was like $2,000 a month. I know it was $50 a month, I don't remember the
Hour.
hour. No, yeah, sorry.
I'm gonna make a motion to pass it back to property for clarification. Are you okay with that, Tony?
I've been waiting this long, I'll wait a little longer.
That have to be put on the agenda for Friday then.
Something's already on the agenda, that's what's the confusing part, is what we're asking for, and what.
That's why I called Terry, because it's like, I had Tony and Terry. And it's like, I asked Terry what to do, and it's like, I got two chairmen,
Well, I mean,
don't know what to do.
property passed it.
Well, you're gonna be on property right on Friday. Make sure they're very, very clear on what we need to do, or what they're requesting.
Well, we already, here's what I'm confused, we already approved this here.
Yeah, by the full board.
And the person already approved it, gave property authorization, board gave property authorization. So why is it back here?
Because
That's where I'm lost.
No, cause I amended it that we wouldn't fill that position tonight, again, by the personnel committee. We weren't there to argue against it, so.
It was on gas that night.
Much fair time.
Now I remember that. I do remember that. I don't know how you guys wanna, I mean, they approved hiring and sent it here, I don't know.
But we've got to approve it before it can move on because of how the motion was made. With full board.
Right, and if the motion in their minutes is that they approved it, what's on the agenda for Friday? Again, a property? The same thing?
No. It says making the facility manager a stipend for that.
Right. Giving that to Gary.
So all we need to do here is approve them proceeding with the position.
I would rather see what they have to say before I mean.
I like making decisions with the quality glasses.
Well, yeah, but you're not gonna change none, that's already been through the county board, Jonathan.
Well, but we didn't, and I don't have a problem if it's Gary or somebody else, but we didn't, especially put it through the county board for a stipend, right? Are we asking to promote? So I guess were we asking to appoint him to that position?
No, that's up to property, not us.
So I think that's what you appointed me the last personnel meeting.
Yeah, but if it passed the board, it's already done, so. No, it's not already done because Jonathan amended the motion that it had to come back to us before it could be filled.
Thank you,
To
Jamie.
do what? To authorize property to fill this position.
We'll maintain this person.
Yes. Yeah.
And that's what they're asking for here.
So they want us to approve Gary for this position, so then that, on their agenda is to appoint him as this position.
That's,
That sounds okay.
yeah.
That's not specifically what they asked for, they asked for fill the position. They didn't ask for, I didn't hear the minutes where it said asking to do a stipend with the facility manager, like you said.
That's what's on their agenda.
On their agenda, but that's not the motion that came here, right?
It doesn't appear to be. That's what I'm saying, we kinda got cloudy glasses on right now.
I get where Jonathan's coming from, they didn't make it clear. I mean, if they're gonna put this on, then they're gonna do the stipend. I mean, the resolution says hiring a project manager. $50 an hour.
Okay, and back up on this a minute, the resolution there. I think this is what we have to go by, and what's on properties agendas isn't even correct. Because the resolution out of the full board is to whether it's Gary that gets hired or somebody else who gets hired, and I too, I have no issue either which way, if you say no or you say yes. But the full board stated that that position is $50 an hour, not by a stipend.
Right.
So for any of that to change, this would have to go back to the full board,
To do a stipend for.
and that resolution would have to be changed.
Yes, I would agree. The way I'm understanding it, unless Rich would tell us differently.
Am I,
You're correct. Rich would say that the, resolution would need to be amended.
So I mean,
If it was
I'll
to
throw
get-
it out there, I will approve hiring a project manager, I'll make the motion to approve hiring a project manager per the resolution. If someone wants to second that, I'll leave that out there for that.
and that's whether it's Gary or whomever, correct?
Well, it doesn't say a stipend, so it's saying a project manager.
And it
So it
says
would have
we'd
to be-
advertise for hire and fill, so it would have to go through.
That's the way I'm assuming the
Process.
the process would have to be.
Is that how the resolution read?
Yes.
I didn't.
They would have they had I think it's in the last paragraph, something to that effect. Hire and fill.
I guess I wanna get compensated for all the time I have invested in this since last September. And, basically, anything further, I guess, in the future.
I don't blame you there, that needs to come to us for property. Yeah, that's what it says. So there is a motion on the floor, is there a second?
What is a motion?
Fill the position per the resolution that was approved by county board. If somebody wants to raise the resolution
Yeah,
before
for the
you.
resolution.
No, that's okay, I'll second it. If the county board already passed it.
Motion's made and seconded, is there any further discussion?
I'll make a motion to postpone until next personnel committee, next regularly scheduled personnel committee.
Now, his motion to postpone by Trump's the one that's on the floor, if I'm correct.
These two are superseding.
But he's, well, motion to postpone Trump's the motion that's on the floor. So there is a motion to, brought forth to postpone until next personnel meeting, is there a second? Ask one more time if there's a second for a motion to postpone until next personnel meeting.
I'll second it. Yeah, get something over here.
Seconded by Mr. Stone. All in favor, signify by aye. Opposed?
No,
You're the decider.
Yep, and I'm gonna say no by this resolution. So we are back to the original motion by Jim Meyer, seconded by Alan Ratzak, to authorize property committee to go ahead and fill this position per the resolution of the April 10th county board meeting. Is there any further discussion on that motion? None being heard, all in favor signify by aye. Opposed?
No.
That motion does carry. As far as your back, take that to property and have problems bringing that here. Okay. Mr. Jacobs.
Good evening, everybody. How we doing? Okay, so a few months ago, Lisa Wissett came to our health officer indicating that she had a desire to retire in January of 2024. I brought this to our board, the Human Services Board, with a plan to, in reference to succession planning for the position, which is reproductive health and preparedness, public health preparedness. As a result, these kids can't take it.
We're gonna get dinner.
Okay, so the succession plan is to fill the position. We have a unique opportunity to fill the position, November and December, because it's a lot of crossover. We're talking reproductive health, which is, STI planning, information, mitigation, awareness, all those types of things. And so within our budget, within our current public health budget, we can account for the projected worst case scenario of $13,108.29, of which that would cost for November and December to bring somebody on board so that they can cross over and do the training with Lisa in anticipation of the January 12th retirement date. This position currently, if we look at a whole year's worth of cost at the grade 11 rate of $24.57 is $79,540. And so my request tonight is kind of twofold, is to allow us, from the recommendation out of Human Services Board, to bring it here to recruit for and allow for that crossover of an employee, hopefully by November 1st. The second portion is the job description that you have in your packet, has some very small changes. Anytime that someone.
We got two different items here, so let's stick on the first one first, okay?
Okay, and really it's just the request to approve, the cost of the replacement to allow for the overlap in the succession planning of $13,108.29 in the Human Services Public Health budget.
$13,108.
That's the same question I asked, I guess you were here with, you have that in writing that she's gonna be done on January 12th?
We do. In fact, we had her write it twice. And the reason being is, I had that same discussion, is what if she changes her mind? Okay, she's made it very clear twice to us that she is retiring January 12th. She's gonna work 10 days in January, and she's done. So, but that does raise an interesting question, of what happens if the person came in and said, hey, I changed my mind, why are you putting it?
My question is, are you have that in your budget to cover the extra church overlap training?
Yes, he stated that.
With charts and graphs, I can show you that we have about $60,000 in our reproductive health fund balance. And the primary,
much?
about 60,000. It's Medicaid reimbursement, and it's only in reproductive health. Sorry, Mr. Meyer. It can only be utilized in, reproductive health services and public health. So, but.
Okay, I get your point, Mr.
Sorry, Mr. Meyer. But the preparedness, the other side of that position, about the 40% of the position, comes from our regional preparedness dollars in the western region. And so this position is funded primarily with grant dollars. It's a unique opportunity. We don't always get the opportunity for someone to say, hey, I'm gonna retire in the future, and we have the ability to cross-train rather than, hey, you got 2 weeks, you're out the door and step somebody in.
I'll make a motion to approve development.
Motion's been made to approve the public health secession plan. Is there a second?
Yeah.
Seconded by Mr. Radsack. Is there any further questions or comments? None being heard. All in favor signify by aye.
Aye.
Opposed?
Awesome, thank you very
Motion
much.
carries.
I think that's a big deal for us, and I appreciate it big time. The second portion is, anytime someone leaves our department, we review the job description, we review the JDQ, we wanna make sure that everything is still what the intent of the position is. And so in this case, in your package, you have the updated job description. The only thing that was changed there is under, there was a couple semantics. The only major change was under the education and experience. That is including the, is that you can see that we took it away from just a bachelor's degree, a 4-year nursing degree. It can be a licensed practical nurse, it can be an ADN, an associate degree of nursing, or it could be a bachelor's of nursing. And so that leaves it a little open. The current position is filled by an LPN, statutorily local. And so that's what we wanted to note there from a job description. my board approved that, and so we sent it here to you guys to review it. Other things were just semantic and sentence structure, clarity types of things. If you don't do that. We wanna review the job descriptions every time when someone leaves, because we want them to be clear, concise, and in a good form.
Is this gonna have to be sent back in?
No.
No, there was nothing on the JDQ that changed. We just opened up the range of what a person,
We've been doing that, we're good with Carlson Devon.
Yep, cause we have grade 10 and grade 11. We have both covered. Okay.
Correct, so what, I'll expand off what Jeremy just said, so you can be an LPN, correct me if I'm correct, you can be an LPN or you can have, be a registered nurse. So depending on who applies, we would just place them either at a grade 11 for a registered nurse or at a grade 10 for the LPN.
Every one of these people are gonna be registered nurses. It's just, are they a 4-year bachelor's of science in nursing? Are they a 2-year EDN? Or are they an LPN? But they're all registered nurses. But we have the 2 grades that are spelled out through the JDQ process.
Is there any further questions for Jeremy on what he's asking here? Changes in the job description?
I'll make a motion to approve the job description as presented.
Motion's been made to approve as presented. Is there a second? Second by Mr. Meyer. Any further questions or comments? None being heard, all in favor signify by aye. Aye. Opposed? You're good.
Awesome, thank you very much for both of those items. You made my day, thanks. Thanks for coming to work today.
10 minutes, you made our day.
Boom. And I was shooting for 5.
Would have been close to 5, it was good.
This is getting quicker, everybody, this is getting quicker.
We appreciate that.
You're no trouble.
Actually, this one is kinda yours.
Which one?
4.
Oh, I believe that's Jonathan.
Oh,
And I no longer support this position, so it's up to you guys if you wanna do the job description or not.
Okay, so none.
that's kinda.
Best interest of the people of Rusk County not to fill this position.
It's up to the rest of the committee if they wanna. Take action on number 4. Or if they do not. The one that has sponsored this for the agenda is now backing out. Excuse me?
Say move on.
Move on, okay.
Mr. Chair, are you okay if we move down to 5E?
Yeah.
Okay.
No problem.
Okay, so I'd like to introduce Lynn, and I forgot her last name.
Rosemeyer.
Rosemeyer. So she currently sits on the Taylor County Board.
Lynn, if you'd like to come up.
Sure.
Then everybody can hear you with no problem.
Sure. So Lynn sits on the Taylor County Board right now, so she has experience, with local government and specifically county government. And she also has years of experience in human resources. Her resume is wonderful. So what I am proposing, we've been, trying to hire unsuccessfully for an HR manager now since January. The last candidate we were in negotiations with, and that didn't work out. With Lynn's experience, I believe we could bring her on in an LTE role. She has a few hours a week that she is generously willing to offer to us, kind of on an on-call as needed basis. I'm proposing, I'm leaving it open to personnel as well, because there is of course a budget impact. This would be a limited term employee. LTEs, casual employees don't have to go through the ad hoc hiring committee. I reached out to Vicki on this already. So this would be, something that could go through personnel, bringing her on in a very temporary, limited role just to help me and, finance, Emily, Brittany, out with HR things here as we figure out a direction to go. And like I said, she's got just years of experience, and so, this would also, I think, help save us in some legal fees. If I have an FLSA question, I would be able to call Lynn first rather than calling, Vicki, which incurs, of course, a cost.
Lynn, Ashley has kind of introduced you, if you'd like to expunge on a little bit.
Sure. So yeah, I've got about 26 years in human resources and also some safety background. I retired in 2016, I believe, from Kraft. So most of my working years were at Tombstone Pizza in Medford. And then we were purchased by Nestle, so went through that acquisition. And then I took a promotion back at Kraft in Wausau, and that is where I retired. And after went through another acquisition with Kraft Heinz Company at that time. So I've been out of the HR world for a while, but as I told Ashley, I think it's like should be like riding a bike and get right back on it and go. So I'm limited on what I can do, but those hours that would work for me also. Any questions for me?
Did you mention that you sat on the personnel committee in Taylor County?
Okay, yes, so I've been on the county board in Taylor County for about a year and a half, so this is my second year. Was just recently, we had a recall in the county, so I was recently just appointed to the personnel committee and also chair of the law enforcement and emergency planning, so that just started last month. I'm also on the human services committee and the health department, and what's the other one? I was taken off from zoning because I was put on these additional ones, so that's my background there. It was interesting sitting in, we have a lot of the same challenges that you do here. It all sounds familiar. We could probably actually, I can learn from you guys and maybe I can share some of our learnings in Taylor County too. But I had a few takeaways, I took a few notes on a few things that maybe I can bring back to Taylor County. Your consultant, that was very good, very, very good information.
Yeah, JA Counter is great, by the way. I'll make a plug for them.
I was really impressed with that, so definitely will take that one back to Taylor County.
Anybody got any questions? Good?
So explain 5A and 5B, how do they work together, how does?
5A is the closed session. I will say regardless of, sorry.
Yep,
Okay.
I'm just saying, that is of the closed session, Jonathan, we are on 5B.
Right, but they look like conflicting things on the agenda, so I just wanna know how they tie in.
We don't, we are on 5B.
Right. So we're gonna appoint the human resource manager and we're gonna hire an LTE for the HR position.
That's gotta come out of closed session, Jonathan. We cannot discuss it right now.
I understand, but how can I make a decision on something I don't know? Not I'm trying to be disrespectful, but again, I'm wearing cloudy glasses.
For now, this one's needed.
need something for HR, I mean, it's not too long.
This is LTE, that's it.
Yeah, this is LTE.
And on call, how many hours a month, or how's that work?
I'm sorry, what?
How many hours a month, or how's that work?
I guess it will depend on what you guys, what your needs are.
So some weeks we might not need Lynn, but some weeks I might have her on the phone constantly. Well, I don't wanna scare you, not constantly, not constantly, that didn't sound good.
So this would be more of a remote position.
Right, so in general, I would call Lynn, and if there was a reason for her to come in, I would just work around her schedule. You know, she has experience in recruitment, so I think she could very much be an asset when it comes to interviewing. And then we would just, like how we try to work around your guys' schedules, we would just do the same with Lynn.
I pretty
But
much,
some of it you could do at home, or.
Yep.
yeah, I'm open to whatever works for you guys, I'm sure I can do a lot of that from home. Yes, if you need me to be here on site, I can do that too. The only workarounds that I have right now are my committee meetings that I'm responsible to be at.
Guess we don't really know what we need yet.
Yeah, be sure, and that's okay, that is okay, yeah. If you find me, you need me just a little, that's okay too. And maybe I can help recruit for your HR position that you've been looking for.
Jim, you look like you got a question.
No, I was already thinking that, what she just said, I think she could help us, hopefully help us recruit, go down that road, so that she's not stuck doing this for another 5 years or something.
Yes, is there any other questions?
I'm just wondering too, would we need a day here and there so she'd be available to employees?
And we could schedule that with her, you know, she'll be in 4 hours Tuesday morning, 4 hours Thursday afternoon, especially as we get into open enrollment. I think that would be great if you know, if we do move forward with this, you know, Alicia is so wonderful and she's so knowledgeable, and we also have Amy and Linda on our team. So when we meet with our benefit counselors and they explain everything to me and Jamie, I would love for Lynn to be involved in that too. So then when staff have questions, we can send them to Lynn.
And I did do a lot of that through the years of employee benefit enrollment time. We used to set up sessions. We had so many days and hours that we would set up to help the employees get enrolled and answer any questions they have.
Any further questions? Guess I would entertain a motion to approve. Motion's made by Mr. Stout. Is there a second?
Yeah.
Second by Mr. Ratzak. Is there any further discussion or comments on the motion that's on the floor? None being heard, all in favor signify by aye.
Hey,
Opposed? Motion carries.
Look forward to working with you.
It's kind of between you two on that stuff.
And I'll get your contact info and I'll be in touch with you.
That sounds good. Thank you for your time, everyone. Have a
Thank
good
you.
evening.
Thanks, you.
you too.
You're welcome.
Tell Suzanne I said hello.
I will do that.
We talk a lot.
Oh, sure.
Yeah,
I just was in a meeting with her this morning.
Yeah, great deal.
She's great.
Yeah, good deal.
I'm gonna ask for a 5-minute recess. I have to use the restroom, so we have a closed session coming up.
Take care.
Lynn.
She used to throw up her camp.
Yeah, oh, I can walk out. If there's a shorter, that's all right. Come on.
Thank you. I'm fine. Okay. That's nice that you guys do that.
He grew up just up the road.
Brings I know. The house is still there. The house is still there.
That's a great deal.
You're right, he did go to Taylor County. It wasn't
Yeah,
Taylor.
probably.
He was
Oh, okay.
for
Yeah, of course.
Clare County.
Oh, they're tomato basil. Oh, that sounds really good.
Yeah, I can't remember now.
Oh, fine. As long as they're sweet. You know, Oli has the, spinach herb. Yes, I like those are good.
I told my boss this morning I took Monday off because I had a cold. She said something about that. I said,
Right.
I started drinking Colorado on Saturday instead of Saturday. My day goes better. He didn't know what to say.
Oh, man.
He's just like, he just started stuttering and then he goes.
I always tell them, I drink coffee in the morning so that people can stay alive that day.
You live in our, township of Plano, do you? Oh, I didn't know that. I didn't
Well,
know that.
they moved into the end of a road.
Oh, okay. I didn't know that. When I saw you at the dump, I was like,
Yeah, the brother used to dump last year there.
that's your brother? Oh, I didn't know that. I'm really gonna give him a hard time now. Yeah. Oh, I didn't know that.
Where did you get that?
58 years, brother.
Device? Walmart?
I didn't
Really?
know that.
Oh, do you guys have a pineapple or slice? I have one. Oh, it's not that great. Really? Okay, I'll let you just like twist
It looks
down.
like it's swallowed up pretty good. Use that.
Yeah.
He's used some times.
You're supposed to have.
Yeah, I love their shake. There's like a Facebook page.
Oh, yeah. Do you know how many things I have from there?
Are you on that Facebook page? Okay, like last week Tracy commented on it, and she's like, just get you a stamp for it. She's like laughing so hard, it's gonna be trying to work today. So I was like, same idea, I go down that aisle with me too, and you find something. It is the worst, like everything you needed.
Oh, yeah, I have some of them.
My taxes in the township, I do it in the city. Like that.
I always forget about it.
I'm not, I'm laughing at the way you put it, Todd.
The week, you guys are the ones that need to stand on.
Bob, you have a plate. Do you want a plate, Alan?
No thanks.
It's chicken wraps tonight.
Okay, next up is a closed session. This time I will entertain a motion to go into closed session.
Terry, should we wait for County?
Excuse
Should
me?
we wait for County to come back for minutes?
Oh, yeah. I didn't pay no attention.
No, I just.
Thanks for catching
Yeah.
that.
If you want me to, do you want me to just jump in?
I'll let her.
Okay.
I can take over.
Take over, Bob.
Write some notes down.
Oh, we haven't talked to that one before.
It's out of her reading glasses.
What did you say there?
Randy said next time.
Super familiar.
I remember how you go.
Better than.
If I ever worked that craft, that was definitely got that.
No, I can't sit there. You can just sit over there.
Barbecue and.
Sit right there.
Crazy. That's all right. It was, if she's really feeling crazy, she puts
Nothing new in my world.
in her cheesecake.
Here you go.
Right.
I looked at Rusk today, see her live.
Did ya? How's he doing?
Better today, he hadn't done it.
Okay. Yeah, it's been kind of rough. I
So
don't lie.
one of his daughter, three was just.
Oh.
The other one,
ready for about 4 hours now, and we're gonna test on me. And they, I'm tired. I went for 2 hours in the kitchen and
Earlier part of the day sometimes too. The, Larry.
Yeah.
Same thing, they live in the bottom, they just, they look at yourself.
Thanks for coming to the one.
Tax assessment.
Buckley, what's happening?
Okay, go to closed session.
They forgot I wasn't here?
1,000 times. They still got that fucking house.
Sorry, guys. One of those days.
Scares me.
No, sorry, it isn't from CC for anything.
Well, they just used me for an excuse.
Yeah.
They did?
No.
Are you? That's not good.
I mean.
Now you make me feel bad.
I don't.
A little bit.
It's a little bit. Okay.
I better get over it.
Yeah, Bob was gonna just a little bit.
He can't type.
Yeah. That's not amazing.
I heard Bob was gonna take over and he can't type. Bobby, you're gonna take over. Type.
At this,
But then we can bear census.
at this time, I would entertain a motion to go into closed session.
Are you gonna do what you did last time? Are you want some minutes to?
Okay.
Did you make the motion last time?
Motion's made, is there a second? Mr. Meyer,
Yes.
Mr. Stump, Mr. Undershields, Mr. Rasak. And yes, we are now going into closed session, Wisconsin statute 19.85, para 1, para C. Considering employment, promotion, compensation, or performance evaluation data of any public employee over which the governmental body has jurisdiction or exercises responsibility. Jamie, I would ask, would you please step out for this?
You have anything else to read? Thank you for everything you do.
No
problem. Exactly, see you Saturday, you know.
Yeah.
I'll make a motion to approve the resolution of the planning resource manager.
Motion's been made. Is there a second? Second by Mr. Stone. Any further questions or comments on the motion on the floor? None being heard, all in favor signify by aye.
Aye.
Opposed, same sign. Motion carries. C.
I would ask that 5C not be addressed.
Okay.
Not gonna either.
D.
Okay, so this committee had originally recommended to the finance committee that we move the staff up 2 steps in 2024, and that would be a wage increase of 2.5%. The finance committee is sending the resolution back to personnel with the recommendation that we only move the staff up 1 step in 2024, which is a wage increase of 1.25%. So that is what has been referred back to you from finance.
No, we referred it to finance, we didn't know the picture of the
Right.
financial picture.
That being said, we're gonna wind up in a position where the 1.25% is actually gonna give them less through the insurance costs.
Right, so, 5D and E are somewhat related. So, are you okay if I cross over a little bit? Okay, so if you have your packet handy from when Alicia gave her presentation, the 2 health insurance options that we are presenting for approval tonight.
Which one are you on, the top one or the bottom?
I think it's number 5, page 5 on the bottom.
Okay,
Okay, so what we're presenting is, okay, it's a base and a buy-up. So the base plan is what we currently offer. It's the Premier Network, Marshfield, Mayo, Prevea, Oakleaf. It's a very open, broad network. It's a 5,000 single, 10,000 family. The out-of-pocket costs are the $66.50 and the $13,300. So that's the plan we've had for the last 2 years, I believe, 2 or 3 years.
Yeah.
Okay, that is coming in at a renewal rate of 4%. We are suggesting that the county approve adding a second option, which is the buy-up plan. So the employer contribution to the buy-up plan would be the same number as on the base plan. So why it's a buy-up plan is because the staff will have to pay more in premiums. However, the trade-off with that is that the out-of-pocket max is significantly lower. So for instance, if you have a family plan and you choose to do the buy-up plan with the higher premiums, you're gonna save, the net exposure is $3,300 lower on that plan. So if you're someone who has a family that is constantly hitting the deductible, like the last 3 years you've hit your out-of-pocket max, it's gonna benefit you to go with the buy-up plan. So you pay more out of each check for your premium, but you're gonna end up saving in the long run that $3,300, if that makes sense. So the deductible is $6,400. You can incur up to $10,000. You can go over the deductible when you have all of those co-pays. And the co-pays really do start to add up, especially if you've got a chronic illness, okay? So you would hit the $10,000 out-of-pocket max. However, the county contributes $4,500 to an HSA. So the net exposure to the employee is that $10,000 out-of-pocket max minus our HSA contribution, which is $5,500. And that was a big point in the employee surveys that we did in not only 2022, but in 2023. That there are several singles and families or employee plus ones that are constantly hitting that out-of-pocket max, and it hurts in the pocketbook. So this is our proposal to you to try to ease some of that. It does come at a cost. So under the buy-up plan, on the very bottom row, in the middle column, that is the annual difference from renewal. So it'll end up costing us about $116,000 more, which comes out to about a 6% increase. And I would like to say that last year, our renewal came in at 9.9%, and we were able to negotiate them down to 0. So last year, we had no increase in health insurance, and the proposed renewal increase was 9.9%. So just, please remember that.
You weren't that talkative this year?
We tried so hard, and they were like, nope, don't you remember last year? So anyways, we were very successful in negotiations last year. So I don't think that a 6% increase over 2 years is a lot, especially when you consider the benefit to the staff. So,
That's 6% for the employer, 6% for the employee.
45% increase for the employee because the premiums go up.
Because they're doing the buy-up.
Correct, they're buying up to a better plan because the out-of-pocket max is lower.
We'd only pay, the county would pay 6% more on only the employees that do the buy-up and.
No, that's the total.
So it keeps the employer cost the same, regardless of which plan the employee chooses.
Okay, so
If we go that route.
so this, okay. The middle column, under the employer, and it says single dependent 85%. Okay, so it's like, for the single, it's 482.32. And then if you scroll over to the buy-up plan, notice how those numbers don't change. Right, so the employee on the buy-up plan is paying a larger percentage.
So we have actually $116,000 in the budget for this.
I did, that is in the contingency line right now. We had a placeholder in there, and then now that we actually, we were initially told that it was gonna be much higher than the 6%, so we were kind of planning more for like a 9-10% increase in our health insurance costs, so 6% is great. In comparison.
So going back to, I guess, the resolution at hand, wages by 1 step or 2 steps, kind of knowing that what we're proposing for our health insurance is a 6% increase. There's the number right in front of you, the 116,000. And Jamie can pull what the number would be for a 1 step versus 2 step.
Yeah, it's really 100,000 versus 200.
So total employee, you know,
Well, what were your original plan under estimating health insurance coming up?
We were,
I
and I
think
just
Alicia-
updated the budgets today, but
Alicia told us to budget for like between 9 and 12%. And I
Right,
think
but what is that figure?
yeah, I think I had about 150,000 as a placeholder for that to begin with. I updated budgets today for finance next week, so I changed, I just updated that amount to be more reflective of our actual, so I was planning for about 150,000. So 116,000 is much more. Yeah, well,
I'm gonna divert to finance.
Because this is in essence give them a two-step pay raise for either benefits and wages, which.
You're talking the insurance and,
We do a one step on the wage and one step on the insurance, that's two steps.
right,
What's your thoughts, what's finances thoughts, because you've got more. Finance and numbers than we have.
well, I didn't remember the number that we had set aside for insurance, but you're saying we're gonna say what, 40 there, 50? What
Yeah,
you really had in there?
about 35.
And a 4% increase on this, I'm looking at this. So it's gonna cost an employee roughly $10
For the increase.
for the
like,
employee's portion.
So,
No, they're looking at this one, Jim,
Right. But what's this gonna cost an employee out of their paycheck?
right here.
it's
It
I
is.
wanna know how much
255,
is
well,
going up.
255.33 if they stay on the plan that we offered, the base plan. I think that's about $15 per paycheck, or per month increase, sorry. Just let me double check.
'Cause I mean, if you use the numbers up above and you keep that the same, I realize it's gonna cost the county more, but the employee out of their check is going up how much?
So like right now, the family plan on the base is about $245 per month, so it's going up about $10.
Oh, $10, okay. So we're covering it with the wage increase. Even at 1.25%, and then some.
Right, I mean, it depends on how much the employee is making. Because your health insurance.
Well,
is
true.
proportionate to your wage.
True.
But, I mean, well, yeah, so that $135,000 increase, that's 85% of the total cost. Well,
Well, this is what this, I mean, when you go back to the survey, the employees asked us for both.
and then the employees,
So if you're gonna do both, you gotta do a little of both, or one of, or more of one and none of the other. That's your choices.
right, and they flat out said that they'd be willing to pay more in premiums to have a lower out-of-pocket cost.
and there's a choice here, so they
Right,
can
so they
choose to
can-
do that, or they can.
Stick with what we've got.
I mean, if we can find it in the budget, I like the better health plan with the lower HSA, and then stick with the one step raise.
So you like what we were presenting with the health insurance
Yeah,
and the 1 step,
cause it's gonna cost, you said what, 120?
about 116,000.
In additional premiums by doing this and covering the HSA both, right?
Yep.
That's like doing another step, in a sense,
Well, we have
because
the,
we have roughly 100,000 by doing the one step.
right,
If we'd done 2 steps, we were gonna be 200 and some change. Now we're back to 200 and some change, but we're giving them a little bit of both, which I would think, and maybe I'm wrong, that employees are gonna be happy with this changing of the health insurance, probably more so than the freeze increase, from what I saw in the surveys. That's just my opinion.
I think so.
It's a choice, right?
yeah,
Yeah,
regardless regardless, we
Absolutely.
have at least a 4% increase. By switching
Right.
our offerings to by offering this, $3,200 plan, the buy-up plan, instead of the second option that we had offered in 23, that's where that a little bit more comes into play. Right.
So
we're-
you're talking on the base plan, down on the bottom.
Yeah.
Lower HSA, that's, just so we're talking about the same thing.
Wait,
That's
We
the
have
plan.
we have a 4% increase on that plan
no
regardless.
matter what.
Right,
Yeah.
right, but with going with this base plan down on the bottom, that is roughly that 115 to 20,000.
Which, the two on the bottom go together, base and the buy-up go
Right,
together.
but let's just say most people are gonna take the base.
Right.
Yeah.
Let's just, I
Personally,
just
that's
wanna
what I'm
work
gonna do.
numbers off the base.
Yeah.
That's gonna affect the majority of the employees, in my mind, anyhow.
Yep.
I mean, yeah, they still have that option, but.
And Jim, I did just double check, 150 is what I had presented to you guys as a placeholder for that insurance
Okay,
budget.
'cause I didn't remember.
Yeah, I just looked back to those ones I had on the Z drive, but I had updated it today based on the actual renewal.
I don't know, whatever you guys think, I mean, it moves us in the direction where the employees would like to see us go. Just-
Anybody else got some input on this?
I'd rather figure out a way to find money for something like this for the employees than something else, maybe.
If you do the survey, don't listen to something like this, cause now.
Yeah.
Right. I would agree.
My biggest fear is somebody winds up in a position that even with the percent and quarter raise, they take less home because of the insurance. That's what I really don't wanna see.
Right, but they did say in the survey that they would be willing to take the bigger monthly hit for the overall savings of a lower out-of-pocket.
Well, I guess I'm getting at the ones that take the base plan, where they still got the higher deductible, and they get a percent and a quarter raise, but with what the 6% the insurance went up, it eats up that percent and a quarter raise, and they're actually taking less home.
You said that's $10, right?
For a family plan
So
per month.
if you do a 1 1/4 raise at $20 is $40 a month, so they'll still get a little bit. So imagine if you're making $10, you still got $20 versus you still didn't get.
And the health insurance premiums come out pre-tax.
Okay. Was there any other questions on D?
Well, last year during enrollment, how many, we had I guess the cheaper plan. Did anyone take the cheaper plan, or
We
did
got-
everyone take the better of the two?
I think we got 11% participation.
Okay, so I mean, you still, what's that, 15 to 20?
It's about 15 people.
Yeah, I got that.
So still, it's still, I mean, that's better than one.
Yeah,
But the results of that survey didn't say they wanted a cheaper health insurance option, they wanted a more robust health insurance option.
So do we think, I mean, sure, so do we think right now that people are going to be interested in the buy-up plan? I'm on the fence on that one.
I think there are a handful of people, yes, that are constantly hitting the out-of-pocket max. Yes,
Okay,
and
and
when
then
they,
it's gonna cost them $182 a month on a family plan, more out of pocket, if I'm reading this correctly. That's 12 months. To save 3,300 on deductible.
no, the 3,300 is the total employee exposure. So
Oh,
the,
that's circled in red?
that's circle in red, yes.
So it's taking the max out of pocket less the employer HSA contribution.
So that would be the total out of pocket that an employee would have to spend. versus on the base plan, it's 8,800.
Let's just drive around the house.
Or the old one was 13,300.
Well, it's 8,800 after you add in the, HSA contribution.
Right.
So Jim, another alternative is we could add a third plan and we could offer the Simply One, that narrow network at the 5,000, 10,000 deductible. Just in case those 15 people are totally fine with that and wanna stay, that would be about a 20% premium savings for them.
So it would still go up from 4%
It
from
would,
where
yeah,
it's
we
at
would
right
still
now,
have the 4% rate increase, but
You know, you have someone that's single, that maybe that's what they're,
Cause then there's the buy-up option, there's the savings option by the
does
Simply
that
One.
affect our negotiating power when we have more plans?
No.
What's the budget impact if we do a third plan?
it could be a savings.
Yeah, it would be a savings. Yeah,
Okay.
I mean, I
I think
don't,
we should offer it to them.
Okay.
yeah,
I mean-
that's the narrow network.
The what?
The narrow network, so that's Marshfield only, so like as Bob said,
Right,
if Marshfield in town here isn't offering urgent care anymore, that could end up costing us more in the long run, because if they have to go to the emergency room rather than urgent care, the costs are much higher. So that's not going to affect our plan for 2024, but our renewals going forward could be affected by that.
but I don't think it's the worst idea to try.
That's what we have to do.
offer
I don't
it.
either, I don't either.
Education.
I mean, my employer offers 3,
Well, people like options.
right?
So do we need to table that till next month, or?
We need to get, no, we have until the end of next week.
So what do we need for motion?
Okay, well, can I go into the, did we make a motion on
We're
the
actually on the
wage?
wage.
No, we did not.
Okay.
We need to back up there.
I guess given we're looking at the insurance, I'll make a motion to adopt the employee, approve the 2024 general employee wage adjustments.
Figures on that.
Do you have
You have
the
the resolution, I think, I sent it to Jill.
Wage adjustment on that wage increase.
At the one step,
There was
I
the-
believe was give or take 100,000,
So they were just reading this.
No, what percentage?
1.25%, correct?
Yeah,
Yes.
is that the
Which is what
resolution?
finance approved.
Okay. Yeah, I don't think I actually showed you guys a resolution in finance,
You got different.
yes, this is the one. Yeah, I had this prepared like last personal meeting.
This is the one, but this county, this is the old one, so.
Yeah, we kept the original one that you guys had signed last month, just in case, cause we didn't really know which direction tonight was gonna go, so. But Connie should have a one for you guys to sign for the one step too.
I gave them
Oh,
to Gary.
perfect.
We played it.
You shot it all.
There you
We
go.
played it.
So right now we have one.
Yes, we do have it.
Yeah.
I do have it here.
What's that,
We
Tim?
haven't voted on it yet, have we?
That's the other two.
Yeah,
Number
that's,
4.
yeah.
So you're reading the wage one?
Yeah.
We
Okay.
changed, that changed yesterday after you
I
last
guess.
Yeah, because the original cost of the
Right.
You made the motion, Robert? Is there a second? To the motion that's on the floor?
What was the motion, to approve it?
Yeah.
Approve the
I'll second.
2024 general employee wage adjustments.
Second by Jim, is there any further questions or comments? None being heard, all in favor, signify by aye.
Aye.
Opposed, same sign. Motion carries.
Can we sign one of these?
You already did, Connie's got it.
What's that?
No, for the wage adjustment.
a
got-
color
Oh, sorry,
version?
Terry, got it.
I got the one you said.
Yeah.
There's one.
Okay, are you okay if I keep going, Terry?
Yeah.
Okay, so I think we have it settled that for 2024, we're gonna offer our base plan on the Premier Network, our base plan on the Simply One Network, both at the 10,000 deductible, and then we're also gonna offer a buy-up plan on the Premier Network. Okay, so that's what we have for medical. Then I'd like to talk about, so Delta Dental is gonna stay our provider with a 0% rate increase for both of our dental and vision. So that was great news. We shopped that out and no one came in lower, and Delta said, we'll keep you at the same rate as 2023, so that's great. What I'm proposing for, our short-term disability, long-term disability, life insurance, and worksite benefits, which we've never offered before, but that also came up in our survey, is switching from Principal to Symetra. So Symetra has more competitive rates. I'm on page 9, if you guys wanted to follow along, page 8 and 9. Symetra also offers the FML administration. FML is complicated, and in outsourcing that, you can make sure that it's done in a way that is applied evenly to the staff. You know, you send the claim off to someone in a call center, they don't know you from Adam, they simply say, I need this form, and this form. And then when you call into the call center to submit your FMLA, they will also say, hey, did you know that you have short-term disability and accident coverage? Well, let's see how we can help you out with that. You know, is this a short-term disability claim as well? Are you going to have a hospital stay? Are you submitting for FML because you broke your foot? Well, hey, you got accident coverage or broken foot, I'll send you you're gonna get a $50 check. So it's a great way to centralize all of our ancillary benefits. Also, short-term disability, long-term disability, and the worksite benefits are a zero cost to the employer. They're all employee paid. If you guys approve us offering the worksite benefits, we will also get the enrollment through Clarity. That's on the back page. This is something I am strongly advocating for. In the past, all of our open enrollment has been via paper. So the staff come into this room, they listen to a presentation, they take one sheet from each stack, and we basically say, good luck. If you have questions, let us know. Otherwise, there's the paperwork, fill it out and give it back. That leads to a nightmare trying to track it down. Open enrollment is always around hunting season. So some people are hard to get in touch with
National
as well.
holiday for the state of Wisconsin.
Right. So what would happen with Clarity is, each staff member who's eligible for benefits would need to make an appointment with Clarity. They get half an hour on the phone with a benefits specialist. For instance, my husband needs a hip replacement next year, and my kids are gonna need braces, and I am accident prone, and I'm always breaking things. I tell the benefit counselor that, they're gonna say, great, type, here's what I'm recommending for you. And if you're like, I cannot afford that, then maybe they switch you to this plan, maybe they lower a coverage rate, something like that. It's a totally personalized experience with a benefit counselor. Also, all of the enrollment happens right on that phone call. The phone call is recorded, so there's proof of, hey, we did go through these options with you, this is what you chose. All of that is done via a portal. When we're through open enrollment, they will shoot off all of the registrations to, whoever's in HR. HR uploads those to Security Health, it's done. No more having to chase down forms. This does put more responsibility on the employee, but I think the 30-minute phone call with a benefits specialist will be invaluable.
Is that the only way to do it, or can it be done online also?
That's the only way to do it, is the telephone call.
They set up a portal though too, so they can make changes and stuff going forward, but they are required to have that.
You have to have that phone call.
But then going forward, like if they want to, if they
if you have a
enroll at
baby or
benefits
something.
there.
The goal is that no one signs up for benefits and is confused. That you fully understand what you're signing up for, you fully understand also what you're declining. So, you know, if maybe you are thinking about having a baby next year, we will talk through why you should look at getting short-term disability coverage. And then, you know, the responsibility falls on the employee to say, you know what, nope, I'm gonna be fine without that.
And you're saying that all of these extra things are no cost to the county?
That is correct. It's all
It's
employee.
options they can choose to add on to their coverage.
Yep, and that's how it is now with our short and long term with principal as well, and we do have participation in both of those. It's fully the employee cost. One other thing that Jamie reminded me of is that with these phone calls, they can be scheduled into the evening. So if your spouse or significant other is the primary decision maker for your household, they can be right on that phone call with you.
Okay, now, life insurance. This $25,000 death benefit. The county would be picking that up, correct?
Yes, so,
At a total of $2,950
for the year,
per year.
and that rate is locked in for 3 years. And we have a funding source for that.
How much is it for $50,000?
It goes up to
It'd be double that.
it's more than double actually.
Is it?
It's like 8,900.
We would not wanna go higher than 50,000 if we have to, there'd be tax implications for the staff. It's an IRS thing, if there's like they have to be taxed for premiums for coverage in excess of $50,000.
Is this strictly for employees only, or can they do it for family members?
Strictly employees.
They can buy coverage for their family members and pay out of their own pocket, but what we're proposing is that basic life just for.
Right, all we
employees
pay
that
for,
are
but if they wanna add
But
another.
they could add their family if they paid for it.
Yep,
And if they want to go with 50,000, they could pay the difference.
Oh, so we supply the 25, if
Yep.
they wanna raise it, okay. So mine has a deal where I can go, I think up to 6 times, without having to get,
6 times your income?
yeah,
Wow.
before I have to go in for physical, or 5 times or something, it's been going up more every year.
Insanely generous.
so there is an amount, and I think it's 150,000 and 30,000, at least that's what it is with principal, where if you enroll right now at the inception, you don't have to go get a physical. If you enroll after that, then you may be subject to that.
Yes,
No, I pay a lot more than this. for
I'm
physical.
sure, yeah.
They cover 1 year's
One
salary,
times,
after that, it's not made a big difference.
okay.
And I'm
But
sure,
it's cheaper than going through a broker just because they cover.
Yep.
Well, they actually make 2 years. They changed it this year.
I'm sure
but
you're
I
right,
can't
there's an imputed, like, income amount.
But then they also have accidental death,
That's part of this.
which accidental death is really cheap for me. I think it's like $10 a month.
So it's a,
$500.
yeah, it's life, accidental death, and dismemberment.
Yeah, yes.
Combined, yeah.
And that's in this too?
That's part of
Yes.
that, yeah, they actually go hand in hand. You
Yes,
can't-
you can't have one without the other, at least with Symetra.
Yeah, so that $2,900.
Well, I
Or
guess if you're
full-time.
dismembered, it's.
Full-time benefit eligible
Kind
employees.
of, cause it completely changes your life.
So what was your funding source?
Okay, so we are proposing that we go through Symetra for an employer-sponsored life insurance plan of 25,000 at a cost of about $3,000. And that we also partner with them to take over our FML administration at a cost of the $3,600. So it's about $6,600 and we would fund it through our HRA account.
So we have that, fund balance, it's the health insurance fund, it was built up when we had HRA rather than HSA. So, we would use, and that balance can only be used for like insurance purposes, so, with the small, like really the FML would be really hard to allocate out grants and other funding sources on the 2,900 for the, basic life and accidental death and disability, would it be worth allocating that out? So we thought that would just be best to put that to that deductible, the health insurance fund.
Okay, before I say, is there anything else that's gonna cost us money out of this that we're looking at?
No.
Okay. I'm gonna throw it out there, I'd like to see the death benefit go to 50.
Okay, let me get that number for you, Jim.
I don't know how the rest of the community feels, but that's,
It's a cheap benefit.
it's a
It is.
very inexpensive benefit, and when something like this happens to somebody with their family, I would not wanna have to be in that cold waiting for, let alone a 20, even a $50,000 check.
Yeah. 25 if you're lucky covers a funeral expense.
Right.
Well,
And probably it'd be medical expenses, right?
Jim, we just did two this last
Oh, yes, can you bring that up?
Yeah.
month. To help
Yes.
some kids.
Yeah.
So there's another part, like the, right now, there's like a grandfathered plan for highway workers that, I think it's like a $6,000 like, or benefit that we pay the premiums on, it costs about $500 per year. But we would terminate that plan and replace it with this, so it's a much better benefit, but that way it's consistent for all employees.
And that's costing 500 for how many employees?
There's probably like 12 that are on it because it was sunsetted. And it was
And
before I
this is
started.
gonna pay more than that one is now, or what?
Oh yeah, it was like a $5,000 or $6,000.
Well, that's, if my quick math tells me that's $6,000.
And not even
so it
all
just
of the
paid for
highway.
itself.
Yeah.
No, the benefit to the worker would be $6,000, it was costing the county about $500 a year.
Yeah, sorry.
Oh,
But
okay.
it was only
500
for
a year.
a handful of employees, because any new employees hired after they stopped doing that plan were no longer eligible for it. They could pay for their own premiums, but, so basically some of the employees at Highway were getting a benefit that others were not. So this would kind of make it even across the board for all county employees.
Well, I think this is very inexpensive.
I do too.
benefit to give employees.
And that was another thing that really came up on the survey too.
Yes, an employer-sponsored lifeline. So Jim, the impact for a $50,000 base life would be $8,621.25. So in total, we would be asking you guys for about $12,000 between covering life and outsourcing FML.
I think that's a lot that you're getting in the pot, so to speak, for what you're spending.
Mm-hmm.
I agree.
Mm-hmm.
Doing $25,000 match for 2,800 piece, right?
And, again, those rates are guaranteed for 3 years. So we could, and I think that's pretty significant. They lock that.
I think it's a substantial benefit for what it's costing. In my eyes, maybe someone else wouldn't do it the same way.
Yeah, and so there wasn't too many. Right.
So then you said, so if we started out at the 50 per employee, and we give them 50 coverage, how does that work for them to upgrade it on their own?
So it would basically be a separate policy that they would get on their own.
But now we were at 25 before, so now we bump it to 50 and say they wanna go to 100, is that gonna give them a better buying power? Versus going from 25 to 100, I think it's gonna save a lot of money, cause they're only gonna go from 50 to 100. If they so choose to go to 100,000 on their own.
Yes. So it looks, okay, are we talking about supplemental life?
I think so.
Okay, so then, yes, I can't give you an exact number because that will change by age.
But the formulas are based on per $1,000 of coverage.
Yes.
So if a person like sort of has $150,000 right now, and if the county's gonna give me 50,000, well then I only need 100, then obviously it would save them money.
Yep.
So I guess the big thing is, we're gonna have to try this and see if it benefits the employees, if it saves them money. It should save them money by upgrading, if they so choose, to $100,000 or $200,000 worth of life insurance coverage by doing it through us, than if they go out on the open market, but we're only gonna know after we try it.
And we currently do have, life insurance offered as like a cafeteria plan with Principal. So it's age adjusted premiums, and so I guess don't pay that much attention to what everybody else has. But I just personally just took the 150,000 for myself, 30,000 for my spouse, so that I could just wham bam be done with it, because that was the maximum amount you could elect without having to go through the other threshold, so.
So I guess what we're asking for in total, and I would say this is worst case scenario, because if we do have some staff that go with the Simply One plan, we'll have some savings. So I think worst case scenario is we're asking for the benefit package increase to be about $128,000. But like I said.
So that's 20,000 less, let's say budget.
Right, and
We
we're
moved-
adding.
We moved in the right direction.
And we're adding life and.
Right.
And 9 of that's coming from a different fund, so it's not to use for that.
About 12.
Or thank you, sorry,
Yeah.
I forgot that we'll pay for the FML out of that as well.
Is there any further questions? None? Entertain a motion to approve.
So moved.
Motion's made, is there a second? Second by Jonathan, any further questions or comments? None being heard, all in favor signify by aye.
Aye.
Opposed, same sign. Motion carries.
Thank you.
Do you guys think that we need to have something come through like a motion of this committee to terminate that highway standard life insurance policy?
I guess we don't feel comfortable ending that without.
Well, do we have to do it now, or we?
No, I mean, we can put it on for
here?
next month.
Yeah, we can't do it tonight, cause it's not on the agenda.
Okay.
Wait, see if this gets in first.
Yeah, I mean, it was kind of asking.
Do
for
some more
guidance.
digging into it, and then we'll discuss it down the road, probably is my thought. Make sure we got our I's dotted and our T's crossed.
Okay.
But I mean, if this is gonna work, and we know we can do it and replace it, then it sounds like a no-brainer to
And
me.
it's 10 times more than the coverage we give now, so I think, yeah.
But I think I agree, Jamie, that it should be out of the in a motion for.
Okay, so we'll try to get that on the agenda for next month then, okay.
At this time, I'd entertain a motion to go into closed session.
Second.
Mr. Stout?
Yes.
Mr. Meyer? Yes. Mr. Undershoot? And yes, we're now in closed session, going into closed session, Wisconsin statute 19.85, para 1, para C. Considering employment, promotion, compensation, or performance evaluation data of any public employee over which the government will have jurisdiction or exercises responsibility.
I'll make a motion to approve FMLA request as presented.
Motion's been made, is there a second? Motion's been made and seconded to approve FMLA request as presented. All in favor signify by aye.
Aye.
Opposed? Motion carries.
I'll make a motion to adjourn.
Second.
Motion's been made and seconded to adjourn. All in favor?
Aye.